Good morning and welcome once again on behalf of the Middle East Institute and our sponsors of the Arab Initiative Transition Initiative. I'd like to welcome you all to today's very timely conference on Syria's humanitarian and political crisis, saving Syria's civilians. You know, over the past 3 years, the people of Syria have endured elevating levels of violence. They've witnessed poison gas attacks on civilians, including women and children. Millions have been forced to leave their homes, and neighboring states are now feeling the destabilizing spillover effects of war. Thousands of miles away here, we sit in the United States, horrified by the reports coming out of Syria, including the recent photos of emaciated corpses of torture victims. It almost seems incomprehensible. The details are not easy to work out, partly because it's very difficult for our journalists to get inside Syria. And as we sit here in the National Press Club, it's worth remembering that many of the journalists have died trying to bring us that story. The Middle East Institute strongly feels that the most trustworthy way to really understand the complexities of what's happening in Syria is to hear firsthand from those good people who are working on the issues in the region and inside Syria itself. Again today, the Middle East Institute has invited key players who've traveled here from the region, from Lebanon, from Jordan, from inside Syria, and Jeff Feltman's case straight from Geneva and New York. And they're here to bring us their story firsthand, share their insights. In a moment, MEI's Senior Vice President, Kate Seeley, will introduce this very distinguished panel that sits before you. These are people who work every day to meet the needs of refugees and displaced persons. On our second panel this morning, Dr. Paul Salem, MEI's Vice President for Policy and Research, will introduce our guests who've traveled here from the region, where they're working at senior levels to fashion a resolution to the crisis. But now I'm going to say something very important. MEI would not have been able to host this conference today and bring the quality speakers that we have on our panel without the support of our sponsors. So I'd like to extend our gratitude, our deep gratitude, to our lead corporate partner, AECOM Technology Corporation, for making the lead donation that has enabled MEI to organize the discussion today. AECOM is a provider of professional technical management support services to a broad range of markets on every continent. They have 45,000 employees who provide services including transportation, facilities, environmental energy, water, and government support. Among those senior officials from AECOM who have joined us this morning are Jim Jaska, the president, David Wall, Senior Vice President for Program, Richard Hill, a Senior Stabilization Specialist, and John Lister, Senior Advisor. Thank you very much, gentlemen. And I'd also like to thank CEO Arthur Keyes of International Relief and Development, IRD, for their generous support in making today's event possible. Since 1998, IRD has provided more than $3 billion in humanitarian assistance, building hospitals, bringing medicines, building schools, ensuring safe water supplies and roads, and providing access to markets and health care. Joining us today from IRD is Jeff Greco, Jason Matchak, and Jim Kunder. And now I'd like to turn the podium over to Kate Seeley, who will introduce this morning's first panel. One last little advertisement. At the break, if you yourselves would like to join our corporate sponsors in supporting the work of the Middle East Institute, we invite you to the table at the back of the room where you can sign up as a member, and with your membership you get a subscription to the Middle East Journal. So I encourage you to do that. Kate?
Thank you, Wendy, and thank you all so much for joining us for today's conference. We're going to have a very interesting couple of hours. Today's panel is going to be looking beyond the statistics and the numbers behind the humanitarian crisis in Syria to examine what this struggle means for the average Syrian and for the future of the development of Syria, a country that, for those of you who had the good fortune to know it before the war, was truly unforgettable due to its incredible beauty, culture, and long history. Most of us in this room today are aware of the fact that this is the worst humanitarian crisis of the 21st century, comparable in scale to Rwanda and the Balkan Wars of the 90s. And yet that fact does not seem to have translated into widespread international compassion for the plight of the average Syrian. There are many complex reasons for this, which I won't go into, but among them, I believe, is the fact that we, those of us who care deeply about Syria, have not done a better job humanizing this crisis. We haven't told the story of ordinary Syrians in a way that can resonate with Americans who are so overwhelmed by what seems to be such an incomprehensible conflict. And today here we want to redress that imbalance by talking about the human scale of this conflict, by talking about how civilians in the rebel-held north are coping, about how this crisis is impacting refugee families living in Jordan, in camps and in villages in Lebanon, and also about what this war means about the future of Syria's human development. And we want to do so to set the stage for a broader policy discussion about what more the international community can do to better address the plight of Syria's civilians. Gathered on this panel today are 4 individuals who've closely followed the situation on the ground and are working very closely to help Syrians in need and to think about Syria, what Syria will need to get back on its feet. I will introduce them briefly. Longer bios are in your program books in the order of who will be speaking. To my right, Mr. Abdallah El-Dardari is the chief economist at UN ESQA in Beirut, where, among other things, he's been leading a team of economists and experts working inside and outside of Syria to draw up a post-war reconstruction plan for Syria, and I hope we'll be implementing that sooner rather than later. Mr. Dardari also served as the Deputy Prime Minister for Economic Affairs in Syria from 2005 to 2011 when he left at the start of the war. Amin Awad serves as the Director of the Middle East and North Africa Bureau at UNHCR headquarters, where he oversees the Syria conflict, along with many others. He's a very busy man. His distinguished service for the UNHCR has spanned more than 25 years and has included posts as humanitarian coordinator during the Macedonian crisis and as the coordinator of Iraq operations. Dr. Uma Kandaleva is a veteran international relief and development program manager and chief of party and country director with over 15 years of experience. She currently leads the IRD, Jordan, and Lebanon country offices where she designed their programs in support of Syrian refugees. And finally, Jomana Kadur is the co-founder and legal counsel for Syria Relief and Development, Inc., an organization that provides direct emergency aid and humanitarian relief for Syrians, mainly in the north, who've been affected by this war. And she's been speaking extensively on Syria's humanitarian and political situation. So I want to thank all of our panelists very much for joining us. It's an enormous honor, and I'd like to invite Mr. Dardari to take the podium.
Thank you very much. Good morning. It's a great honor and pleasure to be here today. What I'm going to be talking about is the fruit of the work of almost 300 Syrian experts working with UN ESQA in Beirut to chart a vision and the way forward for Syria post-conflict. Today the situation is so dire that sometimes we believe we are running out of statistics to describe what's happening in Syria. Let me just give you the latest figures that we have. Every week, 10,000 Syrians lose their jobs. Every day, the Syrian economy loses $109 million. Every month, 6,000 people die. Every day, 300 people lose their homes and become displaced. Every day, 2,500 Syrians cannot lose the ability to provide for their food necessities. And every day, 9,000 Syrians fall below the absolute poverty line. The situation, this is a country where almost 40% of its populations cannot find their daily bread, while 12,000 years ago, it started the agriculture and farming of wheat. The situation, therefore, even with these numbers that I just told you, things are worse than the numbers can speak. And they are worse for a number of reasons. First, because before this conflict, the country had achieved, and it was the only Arab country that achieved beyond the expectations in the Millennium Development Goals. By 2010, Syria was set on the road to achieve all the Millennium Development Goals and overcome these goals by 2015. Today, Syria is 34 years behind in the Human Development Index. So 34 years of human development of the country is lost. The current economic and social situation in Syria is so threatening that we believe that the continuation of this conflict for 2 more years mean that economics alone can break up Syria. The fact that Syrians across the country are living in a war economy that is so decentralized, the idea of a single state is being destroyed every day, and therefore something rapid has to be done to keep Syria from breaking apart. And I'm not even here talking about the military or the political aspects and the social fabric disintegrating as we speak in Syria. I'm just talking economics alone can break up this country in 2 years' time if the conflict continues. Already the country has lost 45% of its GDP. That's almost equivalent to Germany's loss at the end of the Second World War. These are numbers that we have not seen in any conflict before. And 40% of Syria's productive assets have also been destroyed. More dangerously, as you may know, a generation of almost 4 million students has not received any type of education for the past 3 years in a country that was considered a success story in education, especially for girls in the Arab region. Now, this grim picture also comes with a glimpse of hope that Syrians so far still insist that they belong to one country, that the Syrian economy is still running. It did not shut down completely. There's still a glimpse of hope that some state institutions are still functioning. There is a glimpse of hope that areas outside the regime control are trying to patch up some sort of local administration, development activities, and so on. There is still a glimpse of hope that I can tell you today, if the conflict stops now, despite all the destruction, the country has the ability to recapture its previous growth trajectory in a relatively short period of time. But to do so, the country needs, from what we concluded and what we can assume, the country needs a level of confidence between its population, a level of security and safety, and a level of governance that is necessary to start any rebuilding exercise. Our estimates that Syria needs $200 billion to achieve by 2025 what was supposed to be achieved by 2015. So that is the best case scenario. If the country can mobilize $200 billion and can spend these $200 billion in an efficient and effective and transparent manner, and can create the institutions that can manage these funds equally, inclusively, and transparently, and if the regional and international powers concerned with the situation in Syria provide support to this plan, the country will be able, by 2025, to achieve the Millennium Development Goals it was supposed to achieve in 2015. So in best case scenario, the country has lost 10 years of human development. That's the best case scenario. What are the challenges are very clear. What is the governance framework necessary for the government, whatever government of that day, to be able to mobilize, attract $100 billion of public investments? Could that government establish a taxing system, a taxation system to mobilize resources? Could it have enough confidence with the international community to attract official development assistance? Could it have transparent public procurement laws to ensure competitiveness and competition in all these projects? The country also needs $100 billion of private investments. Is the business environment in Syria going to be able to attract $100 billion of private investments? Is there enough separation of powers? Is there an independent judiciary? Is there an accountable government institutions and civil service? Could investors stand equal in the eyes of the law, just as citizens should stand equal in the eyes of the law? They may sound as taken for granted by probably most of you, but you and I know that these are almost impossible to achieve in a very short period ahead of us. However, we also realize that without this governance framework, and that's what the work of the 300 people concludes, without the right governance framework, at the local level and at the central level, there cannot be a reconstruction program for Syria. And the reconstruction program for Syria is not a question, is not a physical question. It's not how many homes you can build or how many streets you can repair. It is a question of a vision, a question of a new social contract between all Syrians to agree on what type of government and governance relationships they want to have. That social contract is the biggest obstacle, the biggest challenge, but also the biggest hope Syrians have. To achieve that, the country today needs to have a common agenda and a common middle ground. What I just presented to you in numbers and the level of destruction and the hope for reconstruction should be a motivation enough for Syrians and for the parties engaged in Syria, positively or negatively, depending where you stand in this Syrian conflict, should be enough incentive to start thinking in a realistic way, in a pragmatic way, in a way that can ensure the end of hostilities and the immediate and rapid move towards peace building and reconstruction. And this, in the opinion of the people who've been working on this project, should start now and should not wait until there is a day after. There is not going to be a clear day after in Syria, where you have a clean-cut situation and you start building a new society. We will be muddling through. The type of transition that Syria will see will not be so decisive for one side in this conflict. And we can see that in the Geneva talks. So it is our responsibility, and I mean by ours is the United Nations and the nations of the United Nations, to start thinking now about what we can do for Syrians, not wait until there is a peace agreement. You may realize, and my colleagues from the UNHCR have much better data than I do on this, that the pull factor in the Syria refugee crisis was very important. What do I mean by that? We have a flood of Syrians into Lebanon and Jordan. and which is affecting the social fabric and the economic structures of those two countries. However, had we practiced some developmental activities inside Syria, even during the conflict, many of the refugees wouldn't have moved to neighboring countries. And even today, there are many things that we can do to improve livelihoods inside Syria that would reduce the flow of refugees and, most importantly, prepare the ground for their safe and dignified return. And I can assure you that Syrian refugees and internally displaced will actually vote with their movement whether the peace agreement that could be reached later is viable or not. The return of the refugees and the IDPs to their homes, and I insist, the return to their original homes, not to somewhere else. They will then have the choice to go somewhere else, but they will have to have the right to go back to where they left. That voting will be crucial to determine whether a peace process is successful or not. And therefore, we need to think about, from now, what could be done to ensure the safe and dignified return of Syrian refugees. Do we have basic things like cross-border facilities? Do we have assurances about the safety of the roads going back? Are there health services on these roads for these people returning home? You are talking about millions of people. Do we have the infrastructure? Even if refugees and IDPs want to go back home and erect a tent next to their destroyed homes, do we have clean water and sanitation and education and health services in these destroyed towns and villages? We need to think about these issues now. It is not too early, it is already too late. People are already meeting in Geneva now. Regardless of what individually we may think about the Geneva process, but we do have a process. And that process is already demanding from us to provide visions and solutions for the future. My team and myself in the UN ESCWA are working on a 10-year vision for Syria, a 10-year vision that is based on a good governance and democratic transition, a 10-year vision that not only helps to invest $200 billion, but most importantly, a 10-year vision that is based on the empowered capacities of Syrians, the brilliant people of Syria and their entrepreneurial spirit, and their ability to produce something out of nothing. And to testify to that, go to North Jordan, go to Lebanon, and see that the first thing a Syrian refugee does is not ask for food aid. It's to ask, where can I find a job? How can I set up an enterprise? How can I create a new business? This is what we are counting on for Syria in the future. I think what we have developed so far as a group to anchor Syrian future development in a program that would, as I said, achieve the Syrian development goals, the MDGs, by 2025, with the hope that this conflict, at least the violent phase of the conflict, would end in the next few months or maximum by 2015. That may be, at the moment, an imaginary goal. Some of you would say, we don't see it ending soon. A proposal like this, a clear vision that is supported by the international community, a clear program that starts today to help Syrians coping with their situation, to help them prepare for early recovery, is, by the way, a very important tool to encourage all parties to talk about peace more seriously. When they see there is hope, there's an alternative, there is a way forward that Syrians can agree on, they will start thinking about, should we continue this futile fight? And from what I see on the ground, and call me a hopeless optimist, there are beginning of signs that people are looking into that alternative already, because the fighting will not produce and fail to produce the outcome that either side thought it could produce. It's time to look at the alternative. The opportunity cost here is very high. The numbers I just presented to you in the beginning is only part of the opportunity cost. The opportunity cost here that Syria can find a future, and we all should invest in that future and support it in peace talks, support it in development, and support it in investing in Syria later. The UN system has started to move away from a complete focus on humanitarian issues towards some developmental aspects. This is a very positive move. It needs to be strengthened, it needs to be deepened, and it needs to be programmed within a vision that the UN and the people of Syria can believe in. I don't want to take much more time than what I did. I hope I'll be able to answer some of your questions. Thank you very much for this honor, for being here with you today, and good day.
Thank you very much. Please. I'd like to invite Mr. Awad to the podium.
Good morning, colleagues and friends, and thanks to the Institute and Ambassador Wendy Chambran for the invitation. I'm very happy to be here. From the outset, I would just say that I will be speaking about as far as mapping out the humanitarian crisis, for the Syria situation, I'll be speaking about the magnitude of the flight of the refugees to surrounding countries, but also the displacement that takes place as we speak within Syria, the challenges that we face as we try to access this population inside Syria or even in surrounding countries, be it in camps or in host communities, but also would like to look at the profile of this population, the challenges that we face, and also the impact on the host communities and the surrounding countries, and the development aspect, security, and economic opportunities these refugees may or may not find in these areas of refuge, the nexus of humanitarian and development, and the challenges that we are facing given the numbers of refugees, among them women and children, and the major challenges that we are facing collectively. We have about 2.4 million people now in the surrounding countries that fled during the last 2 years plus or 3 years. We're entering the 4th year of the conflict now. Inside Syria, we have about 6 million people that already left their home, in addition to 3 million that are impacted directly or indirectly by the conflict. Either they lost their jobs or separated from families that are in besieged areas or hard to reach areas, or they lost some kind of support directly or indirectly. That brings the total to about almost 13 million people that are in need. The appeal that was put out by the UN and another 155 partners, it stands at about $4.3 billion. That is the highest appeal ever in the history of humanity, the history of the UN, and of course begs the question, until when these needs will grow, and how far can the international community afford this? The word affordability is becoming a big issue, and to what extent the surrounding countries that kept their borders open will continue to receive refugees, and at what cost? Their instability, their economic development, the tension between the local communities and the refugees, and so on and so forth. So therefore, we're meeting challenges there. The routes of flights to access the territory of surrounding countries from a protection point of view, some of the border areas remain controlled. Some of the countries, like Lebanon, for example, they kept their borders open. There was a solidarity between northern Iraq and the Syrian communities and the Kurdish communities in Syria and the northern eastern Syria. And in some instances, some of these borders are controlled, and we continue to demarch the government of the surrounding countries, namely Iraq, Turkey, Lebanon, Jordan, and Egypt, to continue to keep their borders open and receive refugees and live up to their international obligations. And by and large, they have been doing that, which prompted us to also embark on demarches and lobbying with the international community to make sure that there is burden sharing and support and recognition for the role these surrounding countries have played in receiving hundreds of thousands of refugees at the expense of their own security and economic development. The number of refugees that I've just mentioned, the 2.4 million, these are the registered refugees. Another 600,000, bringing the number to 3 million. Those are unregistered, and these are government estimates. These 3 million people, only 15% live in camps. 85% live in host communities. And of course, this brought an enormous impact and a constraint on the host community. In villages, if I take one example, in Lebanon, a village that has an original population of 5,000 Lebanese, some of them grow up to be 15, 20, 30,000. Of course, you can imagine the magnitude of problems: education, employment, water, sanitation, electricity, other type of energy, waste management, and crimes, and so on and so forth. The impact is tremendous. The impact also is tremendous in many of the other services that we cannot think of, but also the cost as far as development, pushing some of the Lebanese population into poverty and displacing others who held jobs because of the competitions of the new incoming population. And the crisis, the cost of the crisis in Lebanon, for example, was put at $7.5 billion. Just one example of many. Turkey, for example, estimated that it's not receiving aid from the international community, but it has put about $2.5 billion at the disposal of the refugees as far as the 22 refugee camps that they have created, the services that they have provided to the refugees. Jordan, for example, estimates the cost of hosting Syrian refugees at about $1.7 billion, and the number continue to grow. What are we doing as an international humanitarian community in these surrounding countries? As I said, there are 155 now entities that appeal for funds, and the Kuwait, about 2.5 billion that were pledged, and we'll see what the rest of the year brings. I think one of the challenges is, as I said earlier, how far we're going to continue to increasing the support and ever-increasing outflow of refugees, and how long the international community will be able to foot such big bills, and to what extent surrounding countries will continue and far abroad keep their borders open to receive millions of people. Of course, the only solution is, and the practical solution to this, is a political solution to stop the fighting and the outflow. In 2012, 2013, we have assisted hundreds of thousands of people. We have also contributed to, as I said, the registration of 2.4 million people with the profiling of these families, their vulnerabilities. There's a big push on the education side of things, but it still remains very limited. Among the populations that we have, about 1 million refugee children, 90% of them are not having formal education. They are traumatized. They need social cycle support. They need clothing. They need special attention. There are a number of these children who have been separated from their families during the fighting, and during the flight outside Syria. There's also other challenges that the population is facing as far as the vulnerability of women and girls in the camps and in flight, in refuge, as far as employment, education, literacy, support, gender-based violence, trauma in the homes where they live, domestic violence, and so on and so forth. And this, of course, needs a huge push by the international community, by the local government, and by us, the humanitarian, to make sure that children and women programs are robust and big in number, with adequate coverage to be able to respond to the need of this vulnerable sector of the population. Now, I have talked earlier about the impact of this population on the surrounding countries. And we will see in 2014 a shift in the way we develop, we deliver assistance. It's not going to be a pure humanitarian assistance. It's going to be a mixture of development assistance and a cash-based kind of support. And that is for two reasons. One, I think a lot of this population now that are in exile, they need more than the in-kind support that we give them, be it shelter, be it blankets, be it heating or stove or kerosene. They need also cash to make their own priorities and buy and be able to access services and purchase what they need. But also, by shifting to cash-based assistance, we're injecting hundreds of millions of dollars in 2014 into those small communities. And that will also have a spin-off of creating employment and stimulating these communities that were depressed or restrained by the presence of the refugees. And the humanitarian development nexus will also help the government as far as burden sharing and support from the development institution, the financial institution, bilateral or developmental or humanitarian agencies to be able to offset the pressure and the burden that they face by hosting these refugees. And we are doing that also knowing that this crisis will continue and we have to to stay the course and move beyond the humanitarian, pure humanitarian, emergency humanitarian assistance to other areas that could really help us sustain these communities and keep the governments maintaining an open border policies when it comes to refugees. In 2013, we faced one of the toughest winters. You recall Storm Alexa in places like Lebanon and Jordan and northern Iraq and Turkey and Egypt. I never thought that the Middle East would be subjected to such harsh weather conditions that are comparable to Northern Europe or Scandinavia, where the temperature dropped below minus 20 degrees and about 1 meter of snow in places that never seen snow before. So we have had, since the beginning of the summer actually, in 2013, a very comprehensive regional winterization plan where we put about $216 million in that to basically distribute winter-related relief items from blankets to plastic sheeting to stove to kerosene for heating, wood for heating, but also for the majority who live in collective centers and homes and apartments. We did a lot of construction, rehabilitation, waterproofing, and so on and so forth. That did pay off, given the winter that the region haven't seen for 100 years. The winter is not over yet, and we continue to stay the course and make sure that winterization is progressing throughout the first quarter and beginning of the second quarter of 2014. Some challenges that we'll still continue to face inside Syria: security, access to population that in hard-to-reach area, and populations that are besieged. We estimate about 2 million people of the 6 million displaced in Syria are in areas that either besieged by one side or another, or what we call hard-to-reach areas. Some of these populations are malnourished. They do not have access to services. Some of them have pending operations or health needs that they need to get out of this besieged area to really seek support. Some of the other challenges in surrounding countries is access to territories. Borders in some countries are open, in others are managed in the sense that either they're asking for documentation, will not accept expired documents. They want to make sure that they are not young men alone if they're coming in families. So it's managed in that sense. And of course, security is an overriding issue for some of these countries. Protection space is still important to preserve the protection space that have been created in the region. Durable solution, as Dr. Dari also said, has to be, is something that should not be kept until the end. We should bring the last first and try to talk about durable solution, even in a small scale. We know that some Syrians are returning to areas where there is nothing. Either are there any rehabilitation or reconstruction, even emergency basic relief and rehabilitation programs for areas of return so that people can sustain themselves in these areas and create a livelihood and do not move further and then services will start to spring around them. I will stop here and probably take more of the questions later on. Thank you very much.
Ms. Kandeleva, please.
Ladies and gentlemen, I would like to thank you for coming today. Would like to thank you, organizer of this event, because each of you are basically helping to keep light on a very, very serious crisis which we are facing today in the Middle East region. We appreciate it of all international assistance which we are getting from the American people, from the American government, from faith-based organizations, from UN-based organizations, because these agencies and people, simple people who are contributing to this to this crisis, helping agencies as IRD, being a humanitarian agency with a major goal of providing care to most vulnerable people in the region, to do our daily job. And our daily job is facing crisis and addressing this crisis at every household level. My colleagues from UNHCR and policymakers are looking into bigger picture, trying to address the global crisis from the much more prospective policy view. But agencies as IRD, we are trying to address this crisis at every household level. We are facing challenging every day to address problem of every single Syrian family who cross the border. We have every 24 hours, hundreds of Syrians crossing borders with Jordan and Lebanon. People are coming in the snow, in the winter, without any spare jacket, any spare food. They don't have suitcases with them. They're just holding their children on their hands and crossing border in order to survive, in order to give them protection. When they cross the border, they don't have anything. They don't have a pot to prepare next meal to their family. They are in need of everything. That's why international attention of international donors is extremely important to be able for us to provide assistance to these families on very basic needs. When people are crossing the border, when they are resigning, either in the camps or outside in the local communities, it is really, really important to understand that majority of these children, majority of this population are children and women who really need, they are faces of this crisis. They really required multi-level assistance, not only addressing their basic need as the most important need, basic food, clothing, water, shelter, but they need very, very serious psychosocial support. Their psychosocial and mental conditions as victims of war, as people who just yesterday saw their house blown up or their family member was killed in front of them, they are really under very serious psychosocial stress, emotional stress, and they crossing border of neighboring country, being to Jordan, Lebanon, or Iraq, they simply don't know when they will be able to come back to their homes, if they will be able to come back at any point of time, and how they will find their home, if any home left over. And that's really putting such a serious pressure on their everyday survival. Agencies like IRD, with the primary goal on humanitarian aid, providing humanitarian aid to this population, with the help of UN agencies, we are trying to make this period of time little bit easier for them to cope with the crisis which they face. Definitely, it's a lot of attention, a lot of assistance was provided as of today. But whatever assistance provided, it is not enough. The complexity of crisis is so huge. The complexity of the issues these people are facing on a daily basis is so comprehensive, then more and more attention need to be given to every single Syrian family. Every single Syrian family who are hosted by local communities. A lot of appreciation should be given to Jordanian and Lebanese societies, Jordanian and Lebanese families who opened their houses and allowed Syrian families living with them under the same roof. They're sharing very, very limited resources they have with the Syrian families on a daily basis, but resources are really limited for Jordanians and Lebanese themselves. And now having burden of so many hundreds and thousands of very, very vulnerable Syrians who are utilizing same limited resources in both of these countries, this making crisis is really, really deep. And we need to make sure that attention is given to Jordanian society, to Lebanese families who are really on the edge of their coping mechanism with this crisis as well. The main support need to be given to these communities. The healthcare system of Jordan and Lebanon is really on its edge because of, for the last 2 years, patient load, for example, patient load at every public health clinic in Jordan is tripled during the last 2 years because Syrians are eligible for free health care in Jordan, and the Jordanian government is graciously granted this type of assistance to Syrians. But healthcare system is suffering. Ordinary healthcare providers now is seeing 3 times more patients per day versus they were seeing 3 years ago with the same resources. The schools, there is no space for children in public schools. Most of the public schools are working in 2 shifts. There is no playground left at public schools because we are building extra classrooms. We are putting containers at the playground in order to accommodate these Syrian children to be able to access basic education. The situation in the camp is very, very difficult from the epidemiological point of view to control all these emerging infections, which Jordan and Lebanon never had for years. Now, all of a sudden, we have a very serious issue of controlling infection diseases in the areas where refugees are flowed due to the conditions, living conditions they have. And with the help of World Health Organization, UNICEF, and other ministries of health, this is what is need to be addressed, and we're addressing on a daily basis. But this is ongoing crisis which should not be forgotten. Agencies as IRD, we are trying to provide support on a daily basis, but we rely very much on the assistance and trust we're getting from our donors, from our contributors, until the longer-term solution may be found for this crisis and people will have a little bit of release. Thank you very much.
Hello, thank you for having me. It's kind of intimidating to follow such a prestigious panel. So my name is Jumana, and I am the co-founder and legal counsel of Syria Relief and Development, one of many Syrian American organizations who are trying to address this crisis. Because we do not work under the UN or the ICRC, we have a unique ability to be able to reach a lot of Syrians that are in the rebel-held territories. We do not need Syrian government permission to access the patients and those in need. And a lot of what I'll be telling you today is actually a summary and a synthesis of a lot of information that I've received from the Syrian American Relief Coalition. So just to begin with, I wanted to pull up this map so that I could sort of map out to you where the rebel-held areas are located, and an organization called People Demand Change actually provided this for us. So in the very the northeast corner, at the blue corner, that's mostly controlled by the PYD, the Kurdish groups. That area, I won't go into detail, that's not really my area of expertise, but I do know that it is under less bombardment by the government currently, but there are a lot of inter-Kurdish strife in that region, and so I think we might see things unfold in that area later. Moving south, the Deir ez-Zor region is heavily, it's actually dominated by a lot of different forces, including Jabhat al-Nusra the Islamic State of Iraq and Syria, and the Islamic Front. Moving by by Al-Hasaka province, up north you have outlined in black is mostly controlled by the Islamic State of Iraq and Syria. And although I'm a humanitarian, I have to know where ISIS is located because it is really hindering a lot of the humanitarian aid and has disabled us basically from being able to reach a lot of the people that we serve. Moving west, we have Aleppo, and that's unfortunately been an area where both, ISIS, the Islamic Front, and the FSA battle over control. And there is so much fighting that I have heard from our people on the ground that it will take hundreds, if not thousands of people just to remove the rubble, the debris, and the garbage before rebuilding can even begin. Moving on to the Idlib province, so the green area, that area tends to be the I would say the most stable area of the rebel-held territories. The FSA and the Islamic Front control that area, and that is one of the only checkpoints that we're able to depend on in order to allow cross-border aid to enter. And then, of course, you have the largest area in red, Damascus, Homs, Hama, Tartus, Latakia, all the cities on the coast. There are parts of that where you see the orange that are sort of cut out, suburbs of Damascus that are under rebel-held territories. So these are always disputed. They go between government and rebel-held. And then finally in the south, we have Daraa, which is also a disputed territory. And so when I talk about these, I'll focus a lot of what I'm saying just briefly on Aleppo, Homs, and Damascus, because that's where most of our work is based. We do have a hospital in Aleppo, and we've seen a very huge spike in number of the patients that we're receiving due to the barrel bombings that have been falling on the people of Aleppo. These barrel bombings contain shrapnel, bullets, glass, what have you, and they're dropped on civilians. And recently, actually, one of our coalition partners, their hospital was attacked by masked, unarmed gunmen who followed an ambulance into a hospital, then threatened the staff and killed an ICU patient. And so what this hospital had to do is it's been forced to close its doors and is unable to accept, for that time I know it was unable to accept patients because of the safety of both the patients and the doctors. But slowly, these doctors are coming back to work. They're picking up and trying to go back to serving the needs of the people of Aleppo. I know that the same coalition partner is also part of the polio task force, and we commend them on this great effort because unfortunately with the spread of polio all over Syria, it's created very unique complications. One is that the Syrian government claims to be vaccinating these children. Well, doctors have confirmed that sometimes just regular serum has been injected in these children, not the vaccines that they need. Other times they're sending home the needles with the families and saying, inject them yourself. I mean, it has really baffled the medical professionals to see that this is happening. So what this coalition is doing, the polio partners in the north, they're just vaccinating any children they can find to make sure that these children are actually indeed vaccinated. And unfortunately, only 5% of polio patients ever show actual symptoms of polio. So a lot of times they're, just to make sure, that's why they're, vaccinating any children that they see. Moving on to just a bit about the food and fuel. On the medical note, vaccinations and anything in needles and even certain medicines, they have to be kept at certain temperatures. Some of our partners have told us that patients have gone into shock because they've been injected with medicine that was simply too cold. And so it's really caused complications on that front. The ISIS checkpoints that are placed all over Aleppo have really threatened the population. Many times our doctors and our physicians and our nurses have been unable to go to work because there are checkpoints in their neighborhoods. And because ISIS has been executing people in a very ad hoc fashion, there's just no telling what kind of threat they may actually pose to our staff. And it has been confirmed that they do have access to a lot of journalists. They have been holding them captive, and they have actually killed many activists, journalists, and actors in the Aleppo area. Damascus is also very difficult because parts of Damascus are relatively normal, and other parts are in dire need of support. Hepatitis B has been a problem in Damascus, but unfortunately there are no labs that can verify this for some patients, and because Damascus is not right next to a border, it is also very difficult to get these patients to where they can be seen and be treated. Scabies and lice have been a very large problem because a lot of these families are staying in basements. They're huddled together in very damp and unsanitary conditions. A lot of times, schools, which I'll go into later, are set up in these basements. And so the chances of these diseases spreading is very high. Those who are detained are also coming back with these similar kinds of symptoms. Transplants has also posed a very unique situation. I mean, it's hard enough, I know, for people, some of my friends who've had to undergo transplants in the United States to find the appropriate donors, but it's very, very difficult for Syrians because this is not even being offered in neighboring countries at this point on a very large scale. It might be, here and there, but definitely not on a very large scale. So these people are trying to petition to the United States and Europe to allow them to enter, and of course that's a lengthy process during which a patient can easily die. The lack of CT scanners has caused a lot of difficulty because doctors have had to operate on, brain surgeries, open up brains without without verification of exactly what's going on. But it's too difficult to get these patients safely to Turkey and return them back in time. Now, education, we have another coalition partner who is doing very good work on the education front, especially in Damascus. 2 years ago when the revolution, the crisis started happening, we had many private Gulf donors who were coming to Syria, giving their money and supporting what many Syrians considered very sectarian in nature schools, but unfortunately because these students had nowhere else to go, they were attending these schools. And that we're teaching, I think, kids, ideas that an average Syrian family would not promote. So this organization has been trying to reach out and has reached out to 15,000 students in Damascus to try to buy out these schools and to provide a more peaceful, inclusive type of education for these children. And I think investing in children, as my co-panelists here have said, investing in children is very, very important at this stage because these kids are traumatized, psychologically traumatized. They feel hopeless. A lot of them are telling us we wish we were never born. And providing education, providing a temporary haven for them to leave instead of forcing them, to go out and make money on behalf of their family is really crucial at this point. Damascus also, there's specific complications with food in Damascus because the checkpoints, the government-held checkpoints in and out of these rebel-held areas are very restrictive in nature. They don't allow, even if they open up for a short period of time, they don't allow much food to enter so that they always have leverage over the people in that specific area. They want to make sure that there aren't stockpiles of food. Also, our people on the ground have told us that non-Muslim towns are being given some privileges and are allowed to have food so as to increase sectarian tensions. And this has also been very difficult to deal with. 75% of people in Syria are out of savings and they can't afford to buy the inflated groceries and items that they need. And agriculture, my mother's family is all still living in a suburb of Damascus. And during the summer this year, they finally decided to start growing their food because, Syrians, like Dr. Dada said, they try to be very independent. They don't want to ask for aid. And so a lot of them have been growing their own food and vegetables. But of course, in the winter, that's not an option. And so as much as they try to can, as much as they try to plan, there's only so much you can do in a country like Syria where agriculture is a major way of providing food. And then I'll end briefly with Homs. Homs is the city I was born in, actually. I was born in the Wa'ad province, one of the besieged areas of Syria. My aunt still lives in this area, and we have spotty communication with her, but we try to talk to her and our staff, obviously, on the ground to understand what's happening there. The old city of Homs has been under siege for the past 2 years. And specifically in the Wa'ad province that has been under siege for 9 months, there are over 600,000 residents. This year, we were told by our staff that there were 2,000 amputations that had to be performed without anesthesia. I forgot to mention there was a very, very touching case in Aleppo where there was a woman who needed a cesarean operation. There was no electricity, there was no anesthesia, and what the doctors had to do was have two nurses hold each one of her hands down so as to be able to perform this cesarean. The baby ultimately died, but she survived. But without light, without the appropriate medical equipment, it was very difficult. And the lack of anesthesia, has crippled the treatment of medical operations in Syria. There was another situation in which a military operation, a combination of doctors and FSA helped evacuate 600 patients that were in need of operations outside of this besieged area. 30 doctors and 30 doctors and staff actually died during this operation to save these people. Many people in Homs, as well as other places in Damascus, have been eating grass, shrubs, roots, dogs, cats, and otherwise. A lot of them are uprooting trees completely just to be able to access the roots so that they could either burn them or also cook them. I've mentioned tuberculosis. Over half of Syria's 30,000 doctors have fled, two of which have been my own relatives because were targeted for treating Syrian patients. And petrol and diesel is obviously in very short supply. And buying humanitarian supplies has become very difficult because prices are almost 3 times of what they are in government-held territories. I'll end by just two points that, as a Syrian-American NGO, I would like to say that, as we can throw and we have, and we've seen the United States government, along with other governments, throw billions of dollars at this conflict, and we greatly appreciate it, and it has really helped to save a lot of lives. But unfortunately, until there is a political solution, our hands are tied. Very recently, we distributed aid to a part of a suburb of Idlib, and 2 days later, the village was bombed and all of our work was gone. And these people were killed. It only took one strike to undo all the aid that was delivered. We also ask that we please ask the international community to pay attention to the children of Syria, to make sure that they have education and something other than this war to worry about. Thank you very much.
For their very insightful presentations. They've just put some flesh on a very abstract crisis and have spoken to the incredible courage and endurance of the Syrian people. A certain theme came out here early on in this panel, and that is that 3 years into this crisis, the international community is starting to think very differently about humanitarian assistance. There's a shift in thinking away from traditional giving toward, as Mr. Dardari put it, more developmental activities. You touched upon it. Mr. Awad talked about a shift toward cash assistance. And I'd like Mr. Dardari, Mr. Awad, and Ms. Kandaleva to flesh out what this really means as we look forward at a prolonged crisis. How should the international community and NGOs be thinking differently about helping Syrians sustain themselves inside Syria and outside? And for Jumana, you're doing such incredible selfless work. What would you like to see the international community doing more of to make the provision of aid and food perhaps just a little bit easier? And we'll begin with Mr. Dardari.
Yes, well, I think today there are opportunities here and there across the country that we should exploit, even though they are very limited. And the picture that Jumana just presented to us is a very realistic one. It is not, she has not exaggerated, she did not try to paint an unrealistic picture of Syria. This is what's happening in the country as we speak. But actually, because of this disastrous situation, we need to grasp any opportunity. First, to look at the possibilities of local ceasefires. Secondly, to utilize this as an entry point for humanitarian access, improving access, but also immediately to start working developmental. And developmental activities such as farming. I give you an example. The World Food Program spends $42 million a week on food aid to Syria now. With $50 million a year, you can revamp agriculture in vast parts of Syria as today, before the conflict is over. So activities of that kind, livelihood, microfinance schemes, some public works programs in areas where there is some relative safety and comfort. And these are, unfortunately, not big parts of Syria, but still we need to invest in those. The UN system is considering and should be considering a more integrated approach to entering any area where medical services, education, health, and livelihoods could all be put under one package and presented as one package rather than different agencies doing different things, which is extremely important to optimize resources and have maximum impact. Most importantly, developmental activity can be a very important element in social reconciliation at local level. It's extremely important to make sure, to test at least, could different and conflicting communities work together again on the ground in farming? Could they work together again in protecting archaeological sites that have been destroyed or pillaged? Could they work again in providing social services to their communities? It's from my personal point of view and the group I'm working with, the most important element of these interventions should be the social reconciliation aspect. We need to prepare the ground. Sooner or later, Syrians will have to live together, regardless of their religious or ethnic background. We have no choice but living together. So this is the idea we are proposing now. Knowing the difficulties and appreciating that it is a very difficult situation, as what Jumana just mentioned.
Thank you. Mr. Awad?
Thank you. As to the shift in the way
Could you pull up
group-
your microphone, please? Thank you. Just bring it a little closer.
Okay, thank you. So the new shift that we are seeking as the situation become protracted and as refugees outflows increase is to really work with the host communities and the government to devise some program that will ensure a balance in the distribution of aid that's coming in between the host communities and the refugees themselves, given the fact that the majority of the refugees do live now in host communities. And that is basically working now with some of the development agencies like UNDP. We're working in a big way with the World Bank, which is a new development that we have now in the Syria region. We're also involved with many of the development actors and some of the think tanks and some of the grassroots organizations to help us out in mapping out the households, profiling those households. For example, in Jordan, we just completed 100,000 visits plus to host communities that are where host communities and refugees themselves, to profile the families as far as income, employment, savings, remittance, disabilities, human capitals, skills, size of family, gender, and so on and so forth, to be able to design those programs. We're trying to be very prudent. We started in 2012 and 2013 with a small amount of cash-based programs. Now in 2013, we're going to see a big shift from an assistance-based, material assistance to cash-based. And we're looking at cash for rent, cash for vulnerabilities, cash for winter, monetization, cash for other items. And that's basically we try to also capture the byproduct of this. Employment in the communities, how the cash infusion, the hundreds of millions that will be infused into these small communities will have an impact. Also, one of the most important elements is to give the refugees a choice to do what they need to do. And lack of cash also and dependence on only material assistance on the short term or the long term is not effective. There is a phenomena that we are trying to really stem and control. There is a phenomena of begging that we never seen in this part of the world. Is the middle to high middle income kind of countries, the very dignified communities that they depend on their wider family structure before they really go out begging. Today, if you are in the streets of Bagah Valley, the towns or villages in the south, even in Istanbul, if you are entering the Istanbul airport, you'll see a number of Syrian refugees, mainly women and children, begging. You find it throughout the south of Turkey, you find it in Lebanon, in Beirut, and basically because they don't have cash to, if you interview any of them, they will tell you that 2 dinars to a man to really go to the pharmacy and buy medicine over the counter for a 4-month-old or a 6-month-old baby. We don't have it. So what would they do? They get out of wherever they are, stand in the street to beg to be able to pay that. So we're trying to really also contain some of these social phenomena and address issues that the refugees do face together with the host community. So there's a big push. And we try to also educate the international community with us, the humanitarian and the development, to reorient the program and work in solidarity to make sure that there is an impact and there is a quick impact and efficient and in a very well-coordinated manner to bring sustainability to this issue. Thank you.
I'm very much agree with my UNHCR colleagues because we are working exactly on this direction together, being IRD, being a UNHCR partner in both Jordan and Lebanon. This is what we together are doing. And it's IRD trained community outreach workers knocking the door of 100,000 of households of Syrian refugees and collecting first-hand information on their gender, needs, what this family size, trying to find out as much information as possible about the needs from every single household. We have a very serious focus on community mobilization actions, which we believe is a longer-term developmental approach to solve some of the problems where Jordanian and the Lebanese community have hosting Syrian refugees. We're able to put together at every single community, this is very unique approach which IRD is having in both of these countries. We are able to put together around the table Syrian refugee, Jordanian or Lebanese representative from the community, local municipality person, local government person to sit together and decide what actually my neighborhood and my community need as a first intervention today, what we would need as a tomorrow, a day after tomorrow. They preparing this basic analysis and giving it to us and to UNHCR how we should address not only relief emergency needs of today, but how it's better to address it a little bit down the road. For example, when we, in the northern communities, when we faced serious problem during last summer, particularly during the holy months of Ramadan time in the summer, with lots of communal garbage was flying around, with lots of fleas and cockroaches in every single little town of this area, and people were coming and saying, "This is holy months of Ramadan. We cannot allow our children to see us living in these conditions, but we don't have enough garbage bins to put this garbage." The municipality came and said, "We don't have enough money to rent a garbage truck to remove this garbage out of our community," and that's where we came as IRD with UNHCR, and this, because it was raised from the bottom up to us as their emergency need today, but it has developmental approach. We said, okay, we're gonna help you to rent private trucks to remove this garbage, but you mobilize community for where they are coming in the streets, children and teenagers, women and men, they're coming with equipped and they basically cleaning their neighborhood all together. That has a developmental approach as well as community building trust together, where they enlarge the protection space of refugees, where refugees are not fighting with hosting community members for the vacational space or for next job, but they're coming together to clean up their neighborhood. They better know each other, that contribute to the peaceful coexistence of refugee and the hosting community. That type of projects with a very quick impact and immediate impact on their psychosocial well-being and protection mechanism at community level is very, very important.
Jumana, what would make your aid assistance easier?
Well, I think one thing that the United States government has been doing over the past year, but to definitely increase, and I speak only on, about the US government because I live here, so I'm not going to speak about European countries, but specifically to assist the NGOs that are operating in the rebel-held territories, because I think that they're in a very unique position to reach a lot of people that the ICRC and the United Nations sometimes are simply unable to reach. The second thing I would say is very much targeting the issue of food, diesel, and baby formula, because I think these are the things that are the hardest to find and also the most expensive. Specifically on baby formula. I remember when we were talking to members of the administration about this, and they said, well, to give you baby formula, you have to launch a campaign that assures us that you're encouraging Syrian women to breastfeed. Well, this to me was puzzling because Syrians, as part of their culture, do not look at baby formula favorably, for example. And the reason these women are looking to baby formula is because they're malnourished and their bodies simply won't produce milk. And so we told them there are only so many people, we have to do this work. And you're asking us to expend staff to talk about something that is just not urgent. And these women are asking for these types of aid because they're in absolute dire need. And I would just say the last thing is that helping Syrians who are inside that absolutely need transplants, absolutely need access to CTs to facilitate access to those things. Thank you.
Thank you. Well, we have a large audience here, which speaks to the fact that there is growing interest in the Syrian humanitarian crisis, and I'd like to open up the floor to questions. I'm going to stand here. I'll take a couple at a time. So if you please raise your hand, and we'll begin. Somebody right here had their hand raised? Oh, somebody over here. We'll begin with this gentleman. Is there anybody on this side, and then somebody on this side? Next question. We'll take three and then at a time. So this, yes. And if you could please introduce yourself.
Good morning. My name is Bassam Baravandi. I'm from Syria. My question is, even though the crisis of refugee is heartbreaking for everyone, don't think the international community should think to build capacity for the Syrian refugees. For whenever we have a peace in Syria, we have the guys who are willing and ready to reconstruct Syria. In the refugees, we have doctors, we have teachers, we have economics. It's not only the poor people. Many people left, according to many statistics, because they lost a job, and so on and so forth. So I think even though we have very major problem with dealing with babies, issues and shelters and blah, 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 which is very important, but at the same time, I think international community should put certain budget to building capacity for these people in the refugee camp and inside Syria as well. Thank you.
So is the question also how to better use Syrian capacity for local
I think there should be more programs, this is the question for the UNHCR, for Mr. Dardari, as international community. Do you think that you can put some more budget for building capacity for the Syrian in the refugee camps? We cannot talk only about tragedies. We have to look about to get some hope for the future.
Okay. Thank you. So we'll get over here.
My name is Blake Selzer. I work for CARE. We do humanitarian advocacy policy, but thank you for this important panel. The panelists this morning, I think, painted a powerful picture of the crisis and the importance of humanizing the crisis to get public awareness, in this case, the American public awareness and global public awareness. But we're here in Washington, D.C., so my question for any of the panelists is, what would be your top messages to policymakers up on Capitol Hill? Thank you.
Okay, and do we have a third question? Right here in the front.
Bill Corcoran from the organization ANERA. To Dr. Al-Dadari, curious about the 10-year vision for the rebuilding of Syria, if that also envisions the Palestinians who have left Syria, and whether or not that is a viable option in the future. Thank you.
Thank you. Let's begin with the budget for building capacity with Mr. Dadari and Mr. Awad. Whoever would like to respond to that.
Well, let me say that it is a worthy investment to find ways and means to invest in the capacity building and the skills and competency developments of tens of thousands of Syrians at different levels of education and skills to prepare them for the next phase. The country, first of all, there are Many Syrians who have not been trained have been out of touch with what's been happening. They have not been doing their job anyway, so there's no more training for them. And the needs of the reconstruction will be very different from their previous needs in the country. The skills, the required competencies are going to be very difficult and challenging. So investment in that area will be extremely important. There's a lot of money going to humanitarian issues, as we mentioned. The appeals are the largest since probably World War II. But now, only recently, UNDP, for example, put an appeal of $166 million for some developmental activities, including training. We need to increase that and make sure it happens.
Does anybody want to add to that?
That's very, very good question you asked, and I want to make a note that we at IRD very strongly believe in the capacity development of refugees, and this is what we are doing. For the last 6 years, basically, we were heavily involved in the capacity building of Iraqi refugees who were living in Jordan and Lebanon. And now we are replicating lessons learned, and we are heavily involving Syrian refugees in training programs to build their capacity, and they are providing many of the assistance to their Syrian refugee peers. That's one of the ways when we believe that all the skills they will learn during this crisis, being outside of their country, they can take them with them back once they're back to Syria. For example, one of the largest community health outreach workforce in Jordan is all Syrian women. They are trained by us, and they know basics on community health outreach. We hope this is one of the capacity building investments from our side to them.
I would just like to add that I think SRD, among many other organizations, are utilizing Syrians themselves to complete the work. We're not sending anybody from the outside. We've actually begged some of these doctors in Halab, Aleppo, to stay in Aleppo. And so receiving these grants from the United States government and other entities has enabled us to keep the physicians, the nurses, and the people inside of Syria there, and to be able to pay them, even if it's a nominal fee, to continue working.
And Jumana, do you want to address the question of the top message for policymakers here in Washington? That
stop the crisis. Flex your political muscles, please. We need you to bring, use diplomacy to end this. We can't do our job unless the crisis ends.
Would anybody else like to address that question? No.
We listen to what Jumana is saying. Yes, definitely. Let's stop the crisis. That's the every effort, any humanitarian effort, or even developmental, or what we call coping strategies, resilience support strategies for Syria today, or Syrian refugees, will only achieve very limited objectives if there isn't at least accompanied and paralleled with it a serious political process. Now, that's why Geneva is important, but that's on the side. Jeffrey Feltman will speak about that. Stop the crisis, and as it's becoming clear, it's futile. There's nothing. Every day that this crisis continues, the damage, as you can see, is incredible, and so that's the message. Let's have a clear policy. I don't see yet a clear policy. So let's have a clear policy with the incentives package put on the table to induce parties to come to the talking and to produce something out of these discussions.
What might be an incentive package?
Well, an incentive package which makes it very difficult for the parties to refuse a peaceful proposal. That has not been yet put on the table. We don't see it yet. We see the principles in the letter of invitation to Geneva, in Geneva 1 announcement. Those principles are there. Now, in practice, how do you entice the parties to accept or find it difficult to refuse what's on the table?
Amin, you wanted to comment?
Yeah, I think the magnitude of the crisis and the rapid increase of the number of people affected and the impact of the surrounding countries. 2 or 3 years ago, it was a jargon that this conflict will get out of control and impact surrounding countries, and not only the regional security order, but the international security. And now it is happening. And I don't think really a lot of efforts have been put into exploring and exploiting to the fullest opportunities that may be available to bring a solution. I think both sides of the conflicts are reaching a conclusion that there is no victory through violent or military means, and there ought to be a political solution given the high cost of the crisis, financial, human, and so on and so forth. So I think really there is only one way to go forward. Otherwise, this is not going to be affordable, not sustainable, and it will indeed destabilize the region and beyond.
Mr. Dardery, did you want to address the question on Yarmouk, please?
First, the Palestinians in Syria ultimately need to go home. They need to go back to Palestine. But until this happens, any vision for Syria should include the Palestinians in Syria, definitely. And they are they have been a progressive force in the Syrian society. Maybe people don't know, but in 1948, when Palestinian refugees came to Syria, they were an enlightening force in culture and education and in openness and in liberal thinking for Syria. So they have contributed dramatically to the welfare of the Syrian society. But at the end, and they are treated as citizens. Syria is the only Arab country that treats Palestinians as equal to citizens. But at the end of the day, the best vision for the Palestinians is for them to go back home.
Let's get another round of questions. We have a woman here. Could you wait for the mic, and then the gentleman behind her, and then we'll come back to you. So there are two people in this.
Hi, this is a question for the whole panel. My name is Miriam, and I'm with the Syrian American Medical Society. And as Jumana mentioned, one of their coalition partners' facility was actually attacked by an armed gunman, and they followed the ambulance through. What can we do to protect physicians in Syria and to ensure that these hospitals that a lot of donor money is being used to support can actually operate safely and that they don't have to shut down their doors because doctors are worried for their safety?
Okay, thank you. If you could just pass the microphone to the fellow behind you.
Thank you. I know Israel has spent millions of dollars in transferring Syrian civilians to hospitals they have made on the borders. I was wondering if the panelists thought if there's any way we could utilize Israel as a border nation.
Say that you utilize Israel as a border nation?
Yeah,
Okay.
yeah.
And there's a question from a gentleman over here. If we could just run the mic over.
Hi, Philippe Lecourt to UN Habitat. When we talk about the well-being of Syrian families, we very easily zoom in on health and education. But if you look at the appeals, it's obvious, of course, that shelter and housing solutions is one of their top priorities. Unfortunately, it's one of the most underfunded sectors. It's, of course, not in the public realm. It's very much in the private realm. If you look at the numbers, one of the basic problems, of course, is lack of housing stock that is still standing or appropriate in Syria, but also in Lebanon and Jordan, where the housing stock is just not available. So I wanted to hear maybe also from maybe Mr. Awad and Mr. Dadari on structural measures that could be taken to take that next step, and take into account that the crisis is protracted.
Thank you. All right. Who would like to talk about doing more to protect physicians in Syria? Amin?
Unfortunately, targeting civilians, targeting specific people with specific profiles, sites of prayer, schools, is becoming a way of punishing the population, punishing collective punishment of some sector of the population, and also some areas, but also used as a terror to deter people from physicians, from also or nurses from treating one side or another. And in many of even the PRST, the presidential statement, that was very clear, the call for both the government and the opposition or the rebels, whoever they may be called, to really stop targeting these facilities and this cadre. I personally think that there ought to be an accountability used as a deterrence to deter whatever side from targeting so important sector of the population and the workforce that is helping the population in crisis.
Thank you. Would anybody else like to? Jumana, do you want to talk about that?
I think as Mr. Amin said, it's a very difficult thing. I don't have a solution off the top of my head. It's very hard because a lot of these rebel-held areas go between government control, ISIS control, FSA control. I wish I had an answer. I don't.
What about the question of how Israel can be better sort of utilized in addressing the humanitarian crisis? Clearly, clearly a sensitive subject. I had somebody from the Israeli embassy. Well, were you about to say something? No. Definitely not. Came to say that they felt that the less Israel engaged itself in this issue, the better for all the parties.
That being said, I mean there is evidence that Israel has provided humanitarian assistance and otherwise, and we appreciate wherever humanitarian assistance comes from. I mean I don't think Syrians are turning away any good work that's coming, but it is a sensitive political situation.
Indeed. What about the housing question, construction and addressing this sector? Mr. Dardari, would you like to touch on that?
I have to say that UN Habitat has been doing an excellent job in mapping the housing situation in Syria. They have a very reliable assessment of the situation. In the UN ESCWA project for the National Agenda of Syria, we are working closely with UN Habitat. And that, our colleague from UN Habitat is right to say there needs to be something to be discussed about housing of Syrians today. And I referred to that when I said, suppose we need a coping strategy now, and we also need preparations for possible return of IDPs and refugees. Can you imagine what does it mean to go back to 1-point-something million homes destroyed in Syria? The enormous, the tremendous task ahead of us in providing homes and shelters for these people when they go back. The numbers to be put in perspective: 1.5 million homes partially or fully destroyed in Syria is more than the total houses in Kuwait, Qatar, Bahrain, Oman, and the United Arab Emirates. Imagine that you want to build those 5 countries from scratch today. That's the proportion we need to keep in mind. So I fully agree, and we are working together to find things that what could be done now regarding housing, what could be done in the medium term. Just to give you, if I may,
yes,
to give you example of the challenge of housing, Syria usually used to build around 78,000 homes every year. The need now to rebuild what was destroyed, plus the natural growth rate, is around 350,000 homes a year. So Syria used to consume 8 million tons of cement. It will need 30 million tons of cement every year for the next 10 years. There are not enough roads nor ports that can carry 30 million tons imported to the country. There is the 30 million tons need 1.4 billion cubic meters of water to turn into mix for reconstruction. Syria does not have 1.4 billion cubic meters. We are already a water-poor country. These are practical things we are studying together with UN Habitat and other agencies and trying to see how to prioritize. Where do you start and how to start? What type of building materials may be required? Do you bring people? Most of the areas destroyed are in informal housing areas where deeds and entitlements are not clear. What do? Do you bring people to those same areas that were informally or illegally built before the war? Do you bring them back to those places? Where else would you build for them? How about the social fabric that existed in those areas before the war? Do you rebuild the same social fabric or not? If you take an example of Nahr al-Barid refugee camp in North Lebanon, when it was destroyed, there was a very nice architectural plan, a master plan to rebuild it. But in fact, the families from the Palestinian town of Safad insisted on staying in the same street as they used to before the camp was destroyed. Now, and Ali wanted to live with Muhammad because she was her neighbor before the camp was destroyed. Now, these are realities, and the company, the architectural company that did the master plan, is reconsidering all of that. So, and this is just a small Palestinian camp in the north of Tripoli. Imagine 1.5 million homes. What type of socioeconomic analysis that needs to take place? So the enormity of the conflict requires very out-of-the-box thinking, requires a lot of cooperation, but again and again and again, it requires stopping this conflict as soon as possible.
Well, it's very heartening to know that there is a lot of creative thinking on this subject here assembled before us today. It's been a great honor and a privilege to hear from our fine panelists. I want to thank you all, and thank you all for joining us. And our next panel will begin in 15 minutes. Thank you.
In the first panel in today's meeting on Syria, we had a very, very sobering, very realistic, very moving, and very important communication about the dire circumstances inside Syria, the many tragedies taking place, the extent of the devastation, the humanitarian level, the economic level, infrastructure. We've heard a description of the many types of assistance that are needed. We've heard also about some of the programs and some of the institutions that are engaged in that. We also heard an intense prioritization of the need first to de-escalate and end this conflict. The level of destruction so far has surpassed anything else in this century and compares to some of the biggest disasters in the past century. If this continues for months, for years to come, there might be nothing left to save. We might be talking not about a post-Assad Syria or a post-crisis Syria, but sort of a post-Syria Middle East, where a country really has torn itself apart. The impact on Syria's population and civilians has been much described. The impact on neighboring countries like Lebanon, Jordan, Turkey, and Iraq as well has been amply described as well. It was an excellent morning panel, and we have also, I believe, an excellent second panel this morning to help us focus a bit on the political process that finally has gotten underway in Geneva. This, for maybe a couple of years, was a regional and international proxy war. In some aspects, perhaps we're seeing the beginnings of a regional international proxy effort to bring this conflict to an end. And we're very lucky to have with us one of the people very much involved in this process who came recently from the meetings in Geneva, Ambassador Jeffrey Feltman, to my immediate right. Mr. Feltman, Ambassador Feltman, is the Undersecretary General and head of the Department of Political Affairs of the United Nations. He also had, as you know, a long career in the U.S. Foreign Service, where he was at the end of a long career where he served in Beirut, in Israel, in Iraq. He was Assistant Secretary of State for Near Eastern Affairs, knows the region extremely well, and cares deeply about the region as well. We will hear from him first, but that will be followed by remarks by Ms. Ann Richard. Ms. Richard is the U.S. Assistant Secretary of State for Population, Refugees, and Migration. We heard a lot in the first panel, indications of gratitude to what the U.S. and members of the international community are doing. We're eager to hear more from Ms. Richard, who also has a long career in rescue and relief activity, about what the U.S. And her department is doing, what the ideas are also moving forward. From the European Union, or the European Commission, which has been a big player also in the relief effort, we're lucky to have with us Mr. Enko Gospodinov, who is Special Advisor to the EC Commissioner for humanitarian aid, international cooperation, and crisis response. Mr. Gospodinov is deeply involved in the donor effort in Europe relating to the Syrian crisis, and also has a long history previous to that with the International Red Cross, and a lot of experience on the ground and field work in various countries as how to best address the types of crisis we're seeing. Last but certainly not least, we're very lucky to have with us Dr. Najib Rabbian. Dr. Najib is a special representative to the United States for the National Coalition of Syrian Revolution and Opposition Forces. He too can give us his insights about perhaps what the Geneva process may or may not have gotten started, what are some of the visions moving forward, and how that might impact the humanitarian situation. So let me turn the podium first over to Ambassador Feltman to hear his views about the political process underway, what he might expect in the near future, and how that could positively impact humanitarian relief inside Syria. Jeff? I think they can see you better up here.
Thanks, Paul.
Thank you.
Thank you very much, Paul. And I want to thank the Middle East Institute for inviting me. It's really wonderful to be back in a familiar environment and to see so many friends and former colleagues, including on this panel. And also, just a personal note, with my wife living in Washington, it's very considerate of MEI to do this on a Friday so that I can have dinner with my wife rather than on Amtrak by myself. So thank you. Today concludes my 19th month of service in the United Nations. And in that time, there's been no issue that has absorbed my attention more than the Syrian catastrophe. Secretary General Ban Ki-moon's outrage over the violence and the atrocities and his frustration with the divisions in the international community are palpable in all of our discussions. The UN, I have learned, is a highly decentralized organization compared with the US government. And there are many different parts of the United Nations that are working to respond to the multidimensional Syria crisis. And in my brief remarks today, I want to highlight 4 areas where the UN is responding, and then perhaps in the discussion afterwards, we can go into a bit more detail on the one in which I am most involved, which is the political track. In the 4 areas that I will note, yes, there's been some progress. But in the United Nations, we recognize that any gains we have pale in comparison to the needs. All of us in the international community need to do more to save Syria's civilians. Please note that my list of the 4 areas is my own. It's not a UN reckoning, and it's not exhaustive about what the United Nations is doing. I will not, for example, go into what are really the heroic efforts of the Independent International Commission of Inquiry on the Syrian Arab Republic, which was established by the Human Rights Council to investigate alleged violations of human rights and to establish accountability. The first of the 4 areas I want to raise is something you discussed in the first panel, which is humanitarian relief. Those efforts focus on both the refugees outside Syria and the communities and governments that support them, and on the Syrians and the displaced Syrians and the Palestinian refugees inside Syria who need help. Multiple UN actors are involved. The statistics, as I'm sure you've heard, are just staggering. I mean, 9.3 million people in need, including 6.5 million internally displaced and 2.4 million refugees. There are more than 2.5 million people in hard-to-reach areas with limited access to humanitarian assistance, and we suspect that estimate might be low. In a particularly outrageous violation of international humanitarian law, nearly a quarter of a million people are trapped in areas besieged either by the government or opposition forces. The international community has responded generously, including through the January 15th donor conference in Kuwait, and I want to thank the United States for being the top donor of humanitarian assistance. American officials also have helped us to mobilize other donors. But let's be frank, the needs continue to outstrip the resources available, and security conditions and bureaucratic obstacles continue to hinder relief efforts. We asked the U.S. to use its leverage with the opposition forces to protect civilians, to provide full and unhindered humanitarian access to all people in need, and to protect humanitarian workers and convoys. And yes, we are delivering that same message to those with influence on government forces who are responsible for most of the deaths and destruction. The second area of focus is the UN's joint work with the Organization for the Prohibition of Chemical Weapons, OPCW, in eliminating Syria's stockpile of chemical weapons and chemical precursors. There's a lot of coverage in the media right now of the discussion at OPCW headquarters in The Hague regarding the mid-year deadline for the destruction of all those stockpiles. All of us recognize that to meet that deadline, the pace of removal needs to be accelerated. But it's worth remembering that this is truly an unprecedented endeavor. An operation that's taking place during war, focused on out-of-country destruction, with a unique international effort at sea, and an equally unique joint mission structure. The third area is support to neighboring countries to try to help protect them from the spillover of the Syria conflict. And this goes beyond the humanitarian relief efforts to refugees that I've already mentioned. The Syria crisis poses security and political challenges to the broader region. Secretary General just visited Iraq, for example, to discuss with a wide range of Iraqi officials the need to find ways to ameliorate the impact of the Sunni-Shia divide that the Syria conflict has dangerously deepened. We're most active in trying to help the neighborhood insulate itself from political and security aspects of the Syria crisis in Lebanon. There, the UN has worked in partnership with President Slimani to establish an international support group for Lebanon that has several tracks and capitalizes on an asset that we have in dealing with Lebanon that we do not enjoy with Syria. And that is Security Council unity on behalf of Lebanese stability and security. The fourth area is the political negotiating track that Dr. Salam mentioned in the introduction. I accompanied the Secretary General to Montreux for the January 22nd International Conference, and I participated in the first 4 days of the talks between the two Syrian delegations in Geneva that followed Montreux and that were facilitated by Lakhdar Brahimi, the Joint Special Representative of the Secretary Generals of the United Nations and of the League of Arab States. Those talks, as you've seen in the news, paused today with the intention to resume on February 10th. Now, it should be patently obvious in looking at the horrors in Syria that the costs of trying to impose a military solution on Syria are obscenely high. But getting momentum behind a political track has proven difficult because the divisions inside Syria are mirrored by divisions in the region and in the international community. Tools that might be available to the United Nations to prod parties to negotiations, tools such as arms embargoes or travel bans or sanctions, remain locked away and unavailable. Only Security Council unity can unlock those tools. That need for unity is one reason why it's so important that we build on the broad support behind the 30 June 2012 Geneva Communique and the Russian-American agreement forged between John Kerry and Sergei Lavrov to use that communique as the basis of negotiations between the Syrian government and the opposition. The goal, as Secretary General Ban Ki-moon and Joint Special Representative Lakhdar Brahimi have stated repeatedly, is to end the violence and build a new Syria based on the action plan in that communique, including the establishment by mutual consent of a transitional governing body with full executive powers. The Montreux event was designed to demonstrate to the Syrian government and the opposition that the doors to anything other than a political solution were locked, that the two sides could not escape but must sit down together. Then the Geneva talks under Lakhdar Brahimi's mediation were designed to focus on how to implement the Geneva Communique, which is the basis for the talks. As Lakhdar Brahimi's daily media briefings in Geneva have indicated, this has been tough. I do not believe that any of us expected a significant breakthrough by now only 10 days after Montreux, the first time that the Syrian government opposition sat together in the same room. And we're sobered by the reality that probably not a single Syrian civilian was saved this week through the talks in Geneva. Still, this process is an investment in getting to a political solution, in ending the violence, and promoting a transition to a new Syria. Mr. Brahimi travels today to the Munich Security Conference to brief the Secretary General, Secretary Kerry, and Minister Lavrov on what's needed to help achieve more progress in the next round of talks. Let me conclude by saying that while I firmly believe it is better to have these talks than not to have these talks, better still will be when such talks start to have a positive impact on the ground. Unfortunately, I must candidly acknowledge that 10 days after Montreux, we're not yet there on that point. We're still very much at the beginning. Like Dr. Brahimi described it in the press comments just an hour or so ago as a modest beginning, just the beginning phase of a process that we're pursuing urgently on behalf of the goal to save Syria's civilians and to protect the region. Thank you.
Thank you, Ambassador Feltman, and I'm sure in the discussion session there'll be a lot of questions further about how you see the political situation moving forward, but thank you very much for that. I'd like to call Ms. Ann Richard to take the podium. Thank you.
Thank you, Paul. Thank you for everyone coming out today to pay attention to this crisis, a crisis that deserves attention and deserves solutions more than anything else. I'd like to thank MEI and the fabulous Wendy Chamberlain, who leads it, as well as Kate and Paul, who are doing so much for today's conference, and also my friends with IRD, who I'm delighted to see here today, after seeing you overseas and in hospitals and in clinics and visiting you on the ground. It's great to see you all here in my town in Washington. So good to see you, Uma and Jeff and others. And thanks to ACOM for organizing also. I think you heard this morning from the first panel, so this will not come as news to you, that the U.S. leads the world in contributions for the humanitarian response to the Syrian crisis. Congress, the American people deserve great credit for their generosity. This demonstrates our commitment and leadership. And just recently, I was with the Secretary in Kuwait at the Kuwait Pledging Conference. This was the second time this had been held. And the U.S. was one of the largest donors. Our $380 million pledge to kick off 2014 was among the largest, and we are the top donor in terms of providing $1.7 billion in humanitarian assistance since the crisis began. This is a combination of funds from my bureau, the Population, Refugees, and Migration Bureau at the State Department, and also our colleagues at the U.S. Agency for International Development. The Secretary's presence there himself also seemed to help, and I was told by colleagues from the United Nations and other governments that it helped rally other donors and increase the amounts given. So that's great. I'm very appreciative to him for attending. And part of what we're trying to do through a conference like the Kuwait conference is bring new donors to the table. So that's not always the Europeans and the US, the Japanese, Koreans, Canadians, Australians, but that the Gulf states themselves take a greater interest. And so I'm very appreciative also of the role played by Kuwait for hosting two conferences now, and they were the largest donor each time at the conference, and doing so much to be out in front and supporting these multilateral efforts that we contribute to, that we believe in, that we believe bring professionals to the crisis to do the best we can in responding. So we are doing a lot, but unfortunately it's not enough. And we need to push as much humanitarian aid into Syria itself as possible, using all channels. UN flights, as happened in December from northern Iraq into Syria, are good. But trucks coming in by road would be better. It'd be cheaper, we'd get more things in. And the great frustration for us is that the regime is starving its own people, its own innocent civilians, and doing everything from violating international humanitarian law to just bureaucratic hassles that keep aid workers from getting to where they need to get. So all the humanitarian aid in the world won't make a difference unless there can be access to the people who need that help, unless we can get to them and get to them safely. And as we know, the regime is employing these sort of surrender or starve tactics that are appalling. So we are looking for the regime to ensure immediate, unfettered access to the more than 2 million people in hard-to-reach places in Syria and the 250,000 people, more or less, who are in besieged cities or parts of cities. We would like to see immediate approval by the regime of the UN's full list of proposed convoy movements, an evacuation of people, letting them come out or letting only the women and children come out is not an alternative to getting humanitarian assistance in. Most recently, some aid got into Yarmouk, the Palestinian camp in Damascus, but it's not enough. And if that aid can get in there, it ought to be able to get in other places too. In this crisis, we see incredible bravery and courage on a daily basis. And this is by aid workers who work for international organizations. I know Amina Wad spoke in the first panel coming from UNHCR, which is one of the best, non-governmental organizations, and also local groups, like the volunteers of the Syrian Arab Red Crescent. In fact, if you look at who's doing the most on the ground, it's mostly Syrians, as is the case in all crises. It's mostly the citizens themselves who are helping themselves, and so we have to help them. I wanted to mention a few trends that we see globally in humanitarian response that are definitely manifest in this crisis. One is urbanization, urban refugees, urban displaced. Most of the refugees who are fleeing to the neighboring countries are not living in camps. Even though you'll see photos of camps, the big Zatri camp in Jordan or the well-stocked camps that the government of Turkey has generously set up in southern Turkey. 2/3 of the refugees are living in cities and in towns in neighboring countries. And most of the refugees in Lebanon are living in wherever they can. And what this means is that the refugees can sometimes be invisible and dispersed among local people in poor communities. So we have to find them and identify them to help them, but we also have to make sure we don't just help the refugees. We have to help the refugees, we have to help their hosts, we have to help the poor citizens who are straining their own services to help refugees, but we also have to help the governments themselves. Another concern is violence against women and girls. In this day and age, we know that this will happen any place people are on the move, in jeopardy, fleeing. And so we are working with our partner organizations to develop ways to protect women and girls from violence and also to respond quickly in the sad situations when that happens. And one of the ways we're doing that is the Secretary Kerry has announced a Safe from the Start initiative to make sure that all our partners are good at taking the steps right at the onset of a crisis to prevent bad things from happening and using the best know-how that we have. An example of what I'm talking about is the UN Population Fund has reached 75,000 Syrian women with counseling, sessions on reproductive health issues, and perhaps most importantly, safe spaces where they can go in case they feel that they are in danger or that their children are in danger. And the UN Population Fund has established 31 women's safe spaces in countries neighboring Syria. Another initiative that I think deserves our support and potentially has the ability to break through some of the noise that surrounds the conflict and reach the hearts of Americans and other publics is the No Lost Generation strategy that has been brought forward by UNICEF, UNHCR, World Vision, Save the Children, and others. And the idea is to be alert to the fact that half of the refugees are children, that children are displaced, children are traumatized, I meet children who've come across the border. I've done this several times now with their families from Syria into Jordan. And in talking to them, it's very clear this has upset their whole world, and they have witnessed terrible things. And so Syria will not have a future unless its children and its youth are educated. They just can't be sort of lost for several years in this key moment of their lives. So we support these organizations and others that are trying to find ways to help children get an education, to get into school, or to get something approximating an education, to get vocational training for youth who otherwise would be idle and subjected to all sorts of bad influences, or to help university students get back into some sort of higher education so that they can be part of the solution for Syria. We've also seen in the response to the crisis extremes of weather. At this point, I'm happy to say that a lot has been done to deal with harsh winters that refugees and displaced deal with in this region. But no sooner do we have that taken care of than we really can't rest, because the broiling sun will be out in the summer, mark my words. For people who are living in tents or containers, that can be a tough situation. I guess the good news is that camps and aid flowing in can help people survive. And over the short term, that's really what they want to do. But the longer this crisis goes on, the longer and more elusive peace is, we have to do things so that people have a life, that they have a chance for thriving, they have a chance for contributing and giving back. Finally, we must continue to support the neighbors, these countries that are doing so much, whose schools have gone to double shifts, whose hospital beds are filled with Syrians. They need our support if they are going to maintain their open borders. And we must, as members of the international community, share their burden. And I didn't want to go on too long because I'm very eager to hear your questions. And I also think you will hear some of this echoed at lunchtime by Administrator Shah. We work very closely with USAID on this, AID on this. So thank you for your attention.
Thank you very much for that sort of a description of very important aid that the U.S. is giving and some of the experiences, challenges, and successes that you've had. We'd like to hear from our European colleague, Mr. Gospodinov, if you would like to take the podium, please.
Thank you, Paul. I would like also to thank the organizers of this meeting, as it's so obvious that it's so timely and so important, as every morning we wake up with these troubling news from the Middle East, especially from Syria. So, dear colleagues and friends, I'm sure you heard already a lot of statistics and figures and dramatic stories from Syria. I want to say that we at the European Union, the European Commission, and the member states especially, we are taking the conflict very, very seriously. And we are equally troubled by seeing what's going on there. As our American friends mentioned, we, the Europeans, also take pride of what the Europeans have been doing and are still doing as a collective donor. The member states, the Commission, together, since the beginning of the conflict, we have provided $3.5 billion for this conflict. But again, as Anne said, no matter how much we give, the needs are actually much bigger and more dramatic. Let me mention a few trends and challenges as we see them from Brussels and from the point of view of a donor. First and foremost, the issue of access. This is one of our major concerns. And as Commissioner Georgieva said during the meeting in Kuwait, without access, money means nothing. And it's true. Access to victims of the conflict inside Syria, but also access of those in need, access of the refugees and IDPs to the services the humanitarian actors provide is equally important. The daily life in Syria is tragically difficult for thousands of people, and they need medical assistance, they need protection, they need more or less normal life, provided the context. So it's equally tragic to see those people suffering, but at the same time, we must also remember the tragedy inside the hearts of the humanitarian workers who are trying, very often in vain, unfortunately, to reach the most vulnerable, to reach the wounded. And as I have been doing this job for many years, I can tell you that there is nothing more discouraging or sad for a person from the ICRC or the Red Cross Society or a UN agency or other NGOs. So when you are sitting on 10 or 15 trucks of medicaments and you are not able to deliver those life-saving medicaments to people that are probably only 5 or 10 kilometers away from your warehouse. Donors also need to define what kind of access they need. Are we happy with partial access, or we need full access, which I believe that's what we need? Because sometimes we hear that number of visas have been issued additionally to the UN staff or ICRC or other colleagues, but this is not enough. I mean, issuing visas is only one step that the humanitarians need, but not everything that we actually want in order to reach the people in need. The second issue that troubles us very often is the issue of the safety. Safety for all humanitarian workers who carry out their duties. The erosion of the international humanitarian law, the Geneva Conventions, the disrespect of the mission of the UN agencies, the Red Cross and Red Crescent field teams, and those of other NGOs, is a shocking element of the daily routine in Syria. As you know, so far 34 representatives of the Syrian Arab Red Crescent and 14 UN staff have been killed. There are some abducted also humanitarian workers. At the same time, we must remember that we cannot push the field staff, be they UN or ICRC or Red Crescent people, expats or locals, to take unnecessary risks. I can tell you that I have attended several funerals of my colleagues when I worked with the International Red Cross, and I can tell you it's not a big pleasure to look at the eyes of the parents of our lost colleagues. It's another tragedy. Then the lack of access and safety for the humanitarian personnel impacts also on the key principles of the humanitarian aid, namely the impartiality and neutrality. For us, this is an equally important issue, and we hope the political leaders and the field commanders will pay due attention to this factor. And I do hope that in Geneva, this important issue are being or will be discussed. 4, balance between providing aid to internally displaced and refugees on the one hand versus assistance to the host families and local communities. And it has been mentioned several times by my colleagues so far. I think this deserves serious attention because for those of you here in this room who probably were, like me, working in former Yugoslavia, will recall the tension between the local communities hosting huge number of refugees, and at the same time, you can imagine when an agency delivers assistance to the refugees and the host family living together under the same roof, getting nothing, you can imagine what happens in the hearts of these people. So this is something that we have to remember and work on it. And this goes especially for Lebanon, where my colleagues who spoke before me also mentioned that the vast majority of people live with local communities and host families. It was mentioned already the issue of the Palestinian refugees in Syria, and also we have refugees from Afghanistan, from Iraq, from Somalia. This is an issue that also concerns and troubles us too. 6, another of our concern is the funding. Even if we here in this room, the European Union or the United States of America and other countries that are more fortunate than others, no matter how much we give, the fact of the matter is that the funding base of the support we are looking for is still fairly narrow. And I agree with my colleagues that we really need new donors. There are a number of Gulf countries that probably would like or could have done and will be doing more. As if you take only the UN appeal for 6.5 million, you may add a billion, sorry, and you may add probably maybe 1 billion more from all other international organizations and NGOs, and this is really a very serious amount of money. But I must say that we feel sometimes the fatigue. We feel sometimes we get the questions for how long this will go, and provided also the context, the economic crisis, the fiscal discipline many governments are trying to impose in this very specific situation in many parts of the world. Finding fresh donors and fresh money is very important. Last year, the European Union and the Commission and its member states provided 7 times more than what we pledged during the first Kuwait meeting. Now we have, during the Kuwait 2, we have pledged 753 million. Again, I'm afraid that's not going to be enough. We'll do more, of course. We'll try our best, but we do hope that new donors will join us. Also, one of the colleagues mentioned here something that we consider very important. We do need more implementing partners inside Syria. We know it's not easy. We know even for experienced and solid players like ICRC and the UN agencies, they are doing their best, but without the local partners, without investing in their capacity, plus in the capacity building of our partners, this is something that we are thinking seriously of. These were the issues that are mainly of political nature. Let me mention very briefly, as time is flying, a number of issues of sectoral and or technical character. One issue is the looming health crisis in Syria due to the conflict and of course, the limited numbers of health actors in Syria with solid operational capacity. The disruption of routine vaccination, the destruction of public health facilities and hospitals, deterioration of water and sanitation services have resulted in the emergence of epidemic and communicable diseases, while volatile security conditions and attacks against medical staff and the facilities prevent an adequate health response. Equally important as Ms. Richards mentioned the danger of losing a generation in Syria is very, very knocking on the door, unfortunately. And we take this very seriously, and we are supporting all members of this initiative to try and invest in education of the young generations of Syrians that will need to rebuild their country once the peace is being achieved. Social, economic, and demographic consequences, especially for Lebanon. This has been mentioned already. We are also very, very concerned. I think the Lebanese people are showing enormous courage, hospitality, creativity to host, I'm afraid, almost 1 million refugees that may hit the country by the end of this year. Currently 800-something thousand. So the social fabric, the demographic structure of Lebanon may be seriously affected, and we as donors also keep an eye on this process. Linked to this is the urgent need to strike the right balance between emergency and development. I remember, again, we spent billions in former Yugoslavia. The same we did in the 11 countries when tsunami hit in 2004 and 5. And very often you know how quickly the emergency aid disappears, but then if we don't do anything in the field of development, we have done very little. Verification of the most needy, tracing unregistered refugees without residence permit in Lebanon still remains a technical problem, and our implementing partners are telling us that some 50% of the refugees in Lebanon will have their visas expired by mid-2014. And the information that I have shows that a visa renewal costs about $200. So for all these issues, we have to find coverage. We also need a comprehensive response strategy for Syria, and we are very encouraged to hear from our UN partners that this may be ready by the spring this year, because with the changing nature of the conflict, we have to apply certain flexibility, but also long-term view in order to know what to do in the future. Finally, let me reiterate that the European Union, the European Commission, and the member states remain committed to helping those in need based on the needs and the humanitarian principles. And if you allow me, I'll recall what Dr. Henry Kissinger used to say about Europe. I can tell you that Europe does have a name and a phone number when it comes to humanitarian assistance. Thank you very much.
Thank you very much, Mr. Gospodinov, for sharing those priorities and suggestions and agenda items. I'd like to turn the floor to Mr. Ghadbian for his perspective.
Thank you, Paul, and thank you for the Institute for this timely conference. I was asked to address what the Syrian Coalition is doing on the humanitarian front, and to give our perspective as maybe how to explore some ideas to end this tragedy. I will spare you the numbers. We've heard them in the morning. Some of my other colleagues have contributed to that. But I would make 2 points. The first, this is a humanitarian catastrophe by choice. It's not a natural disaster. It's not a tsunami. It's created and sustained by a regime which in fact decided to put down a popular uprising which started peaceful, like other countries. And the regime continues to systematically deny access to certain areas, populations, which in fact account to another crime against humanity and war crime, added to a record, in fact, of war crimes and crimes against humanity. One of those is the use of chemical weapons. Another is the torture and killing of political detainees. We all heard about the latest report that documented 55,000 pictures belong to 11,000 political prisoners, added to the use of all kind of heavy weapons against civilian areas, the use of barrel bombs, which in fact did not stop for a single day while Geneva was going on. So this is an interesting situation. This is a regime that got away with so many crimes against humanity, but because it was, number one, smart about it, doing it by installment, and second, because the international community allowed it to do it. It's the paralysis of the international community to protect Syrians that really made this possible. What is we're in the opposition and the coalition doing about these issues? Many of us found, in fact, ourselves from day one forced to deal with the humanitarian issues. We are, many of us, political activists, but the scope of the humanitarian tragedy forced us to address that. Going back from the early, in fact, days of the opposition activism, when we started a series of conferences to try to be a voice for the Syrian people, into the formation of the Syrian National Council, which preceded the formation of the coalition. I could tell you in the Syrian National Council, and I was a founding member of that group, the first installment of assistance we got from a friendly country, $15 million, 90% of it immediately was allocated for humanitarian relief that was needed in areas like Homs, Daraa, et cetera, et cetera. The same thing when the coalition was formed with the help of many, many countries, which we are grateful. We again, one of the first institutions we created was the Assistant Coordination Unit, which we felt needed immediately to be able to work with the international donors to reach, again, many, many Syrians who were living in difficult and, in fact, inhumane conditions. The second, maybe important composition of the coalition was a group called the local councils. These are groups that were created in different provinces, the 14 provinces of Syria, in order to work with the ACU, to work with the international donors, to provide humanitarian relief, to provide some basic services and basic governance to those areas. So the coalition's commitment to those areas, in fact, and in order to put this into perspective and put the question of maybe, you know, the opposition should do more to address these issues, we should, you know, understand this issue that most of those people who are suffering, the more than 130,000 falling heroes and their families, the more than 10 million displaced, internally displaced or refugees, these are our base. These are the Syrian people who are, in fact, calling for change, and they were punished because they decided to take action. So to us, our commitment to the well-being of these groups is unquestionable. Our commitment to specific programs, like allowing relief aid to any area, is something, again, it's in our best interest. Beside, of course, it's the right thing to do. Our commitment to the implementation of the UN Security Council presidential statement on humanitarian access has been, in fact, many times not only been expressed, but shown to be the case. Let me say a few words about Geneva and then end with maybe 2 or 3 points about recommendations. As we went to Geneva, and this is something we were committed to do, we were committed to a political solution. We supported every initiative presented by the Arab League, by many countries, to find a political solution to this conflict. We kind of asked that maybe 2 issues can be considered as confidence-building measures. The first, we requested that the regime would grant humanitarian access to, you know, specifically the Ghouta, Homs, and the more than 260,000 people in cities living under siege. And that's something basic. This is an obligation that, in fact, the regime should do. It's not a subject for negotiations, and then I'll come to address that point. The second, we ask that the regime release the women and children prisoners. And by the way, it's my understanding that in one of the sessions between the two sides, that Mr. Jafari, who represents the regime in New York, denied that they have any women and children prisoners. And we encountered by presenting them with the names, whereabout, the addresses of all of those prisoners. Of course, like they denied chemical weapons was used, as they deny that this whole thing is nothing but a conspiracy against the regime, and this is nothing but a terrorist war against the Syrian regime because of its standing on issues like the Palestinian and so on and so forth. So again, we went there with these two requests, and the regime in the first 3 days tried to bargain and negotiate about these issues. And to us, our positions, these are non-negotiable issues. These are something that the regime could do right away to show its commitment to a political solution. Of course, they refuse even to allow 12 convoys into Homs, which they agreed to before in front of Mr. Kerry and Lavrov. They tried to say, okay, only 3 trucks. And then they said, no, we would allow women and children to evacuate, but not the men. And the trick here is very important. By so doing, they would say the rest of the men are terrorists, and then they go and erase the rest of the town. The other issue, of course, that would contribute into creating their policy of creating sectarian cleansing in a very sensitive areas, so they could continue on with their policy of maybe creating some kind of a sectarian enclave in the future. So. As far as Geneva, even though the first really week of the negotiations, and maybe Mr. Feldman can say more, have not really produced any substantive progress, but I think their holding by themselves were important. And I would say from our perspective, in the coalition, we came out good of these negotiations. We showed our commitment to a political solution, to ending the conflict, to finding immediate relief to the people living under these, again, inhumane circumstances, and to releasing political prisoners. So we will continue, in fact, to be engaged as long as we find there's, in fact, any worthwhile outcome might come out of that. But let me say that we find it difficult, in fact, to continue to attend rounds which will not lead to any substantive, in fact, or improvement of these conditions, like in the areas under siege. And I think this is something we need to be very clear about. What's needed from our point of view? Let me just suggest a few ideas and end here. I think what's needed the most is to put an end to Assad's brutal campaign against the Syrian people. In the morning, we heard from Jumana how all of the great work, many of the Syrian American and many of the international and in fact, friendly countries doing in terms of providing aid is always disrupted by the continued use of violence by the regime. So I think this is a priority. This is absolute priority. Allowing an immediate and fettered access is another priority. And I think, like we've seen with the chemical weapons, it took the work of the Security Council, but it really took the resolve of the Obama administration to use the credible threat of the use of force on the table, which finally forced the regime to give up its chemical weapons arsenal. And I would suggest to you that if we need to solve the other two issues, the humanitarian tragedy, and reach a political solution, we might need same resolve we've seen with the chemical weapons from this country, from the European countries. As Ms. Richards mentioned, the US is a leading country on humanitarian issues. We want the US and the European Union to be leading countries on finding a political solution. And yes, we'll try to work with the Russians, but if that doesn't work, I think the US, other countries that are more responsible and care about humanitarian issues, they might need to consider more forceful course of action. I would say that it's my understanding that in New York, some of our friends might be presenting, in fact, a UN Security Council resolution within a week if Russia does not use its leverage over the regime to allow some access to some of the areas like Homs and Ghouta. So we definitely support that, and we would like to see more action. While we're doing this and pursuing a political solution which would create transitional governing body that is responsible, that is committed to human rights, committed to international law, committed to respecting international humanitarian laws, they are, of course, always the immediate need of many of my colleagues mentioned, especially as far as providing food, medicine, medical equipment, and so on and so forth. And of course, dealing with especially providing education, psychological care for children. I would end by saying, to really address this question of the humanitarian catastrophe of the century, which is an outcome of a conflict, we need to put an end to the conflict, to the siege, to the shilling, to the Assad mafia. Thank you.
Thank you very much, Mr. Ghadbian. Before I turn to the audience for questions, and please, think of the questions you would like to pose, let me pose a couple of my own. Ambassador Feldman, there's been a lot of progress just to get the parties this far to have a Geneva conference, which only weeks before was a question mark whether it would take place or not. You've indicated that there are a lot of tools that are still locked up because the Security Council is not yet moving unanimously on this. Do you see a momentum change both in terms of the positions of some of the main players, the highlighting of the humanitarian urgency? If we want to sort of conclude with this session with looking ahead and expectations and things that we might or might not see, do you see things in the international arena and perhaps in the regional arena from your perch in the United Nations moving in the right direction that could activate the Security Council in important ways, and if so, how? For Najib, I wanted to ask, every negotiation requires somebody on the other side that might at some point become a partner. Obviously, the Assad leadership, the family, the regime, as you say, perhaps is or is not serious about this, but the many people in the system, in the regime, in the military, perhaps people who have chosen the regime for now over others, is there a strategy? Is there a reaching out to other partners within the media orbit, within the regime orbit, that could be part of a solution, either centrally or locally in different neighborhoods and different areas? Finally, for Anne and Enko, the emphasis on not losing a generation, which obviously when one looks forward, one looks at that. What more could you tell us either about other success stories and other cases where the children of refugees were effectively saved from being lost? How can that be done? Are such efforts already underway in Lebanon, in Jordan, or perhaps in some areas in Syria? Is there any good news there from other countries? And could that be a defining aspect of the aid in 2014 in order to save the future for Syria? Let me turn to Jeff first, if you'd like to share some remarks.
Paul, thanks.
It'll come on as you speak, I believe. Yes.
Okay, Paul, thank you. I'm an American. I like to be optimistic. I like to look at the glass half full rather than half empty. But I don't want to exaggerate this. I do see some positive trends. When I look at the unity that developed around the threat of serious chemical weapons, when I think about the work done to get to the humanitarian PRST, the work done to build momentum before the Kuwait conference, and when I listen to the statements made by 40 plus countries plus 3 international organizations at Montreux, I heard convergences. Convergences that I think we can build on. But I don't want to overstate this. The differences are enormous between the Syrian parties on the ground and between some in the region and international community. Montreux was interesting, though, because you had countries as varied as China, Russia, the United States, Saudi Arabia, the list goes on, talking about the need to use the Geneva Communique as the basis for negotiations. That was, in fact, the basis for the invitation. The invitation of the Secretary General to the Syrian parties, to the other participants in Montreux, stated clearly that acceptance of the invitation mean you accept the Geneva communique. Well, that was emphasized over and over and over again by speaker after speaker after speaker. The only exception, frankly, being the Syrian government was emphasizing more security issues. But that convergence of international views is something I think we can build on. I would encourage all of you to look at what Lakhdar Brahimi said today in his press conference. Under the rules of the Geneva talks, Lakhdar Brahimi is the only person that is to speak officially about the talks. The two Syrian sides obviously give their own views to the media, but the only official commentator on the talks themselves on what happens inside the room is Lakhdar Brahimi. So I'm going to paraphrase him rather than give you my own views as part of abiding by the rules. But he talked about convergences that, despite a very difficult week, came out. Things like the two sides agreeing to talk about all aspects of the Geneva communique. That wasn't obvious that was going to happen at the beginning of the week, I tell you from sitting in the room. The agreement on some broad principles, this may sound self-evident, but things like the fact that the Syrians themselves, not any outsiders who may be participating, have to decide on Syria's future. The commitment to Syria's territorial integrity, unity, diversity of confessional and ethnic makeup, these are general principles, yes, but they're things that Mr. Brahimi explained to the press today. He heard from both sides today, and they're things that he can build on. So yes, I do see some positive trends, Paul, to answer your question, but I don't want to underestimate the differences that still have to be overcome in order for those positive trends to really translate into change on the ground.
Thank you, Jeff. Najib?
It's a difficult question, Paul, to really answer because we are dealing with a regime that it's hard to believe that they would come to negotiate their departure. I mean, and that's really the essence of the Geneva Communique. It's the creation of a transitional governing body with full executive authorities, which would mean including, and there was more elaboration on this by even Lakhdar Brahimi, the powers of the army, intelligence, military, and so on and so forth. Nonetheless, I think it is, as Mr. Feldman said, this is the first time that we have a framework. We have some basis for a political solution. And the other side, despite all of its denials and skewed interpretation, they kind of, they came and accepted part of that. One of the weaknesses facing those who came to Geneva is that I think none of them are truly decision makers. I think they were on Skype with the presidential palace the whole time. At least somebody can listen to what they're saying and to what the opposition was saying. In that sense, again, from our point of view, and we do see that the departure of Assad, the sooner this happens, the more it opens the door for a true political solution, for national reconciliation. The difference between us and the other side is that we believe the other side does exist, has a, its own reasons to support the regime, and we're willing to work with anyone. Our only criteria for those who are not acceptable as part of the transitional governing body is those who have not committed crimes against humanity. And we accept the Human Rights Council designation, the commission for that. So I think that's a huge difference. While the other side still sees us as terrorists and agents of foreign countries and so on and so forth. But as you said and suggested in your question, by making that case to the Syrian people, that we in fact look forward to creating a new Syria that's committed to democracy, pluralism, to protecting the rights of every citizen in Syria based on equal citizenship and the rights of minorities and respect for women's rights. I think the other side for the first time should see that there is in fact a possible a solution, and we hope again we will find partners from the other side who are committed to the same principles, even including some of the principles Mr. Feldman mentioned.
Thank you, Najib. Enco and Anne on saving a generation, how it has been done anywhere else?
Well, I would like to mention few things. As Commissioner Georgieva was very enthusiastically supporting this No Lost Generation initiative. in Kuwait, and we discussed in Brussels with my colleagues. I will mention a few details. One field where we can do much more, provided we have good programs, is the field of education. With so many refugee children in Lebanon, in Jordan, in Turkey, in Iraq, one of the major problems, even if it's kind of hidden now and quiet, it will explode in a few years when we have hundreds of thousands of children without future, sick, many of them, jobless in the future. And I can tell, we went through this in former Yugoslavia. You will remember that the conflict started actually in, I think, 1991, in June in Slovenia, and ended up in Kosovo at the end of the summer in 1999. Almost a decade. You imagine how many children were affected in those independent countries now in former Yugoslavia. And we asked ourselves at that time what we can do, and we started together with a number of private companies organizing education in the refugee camps, healthcare that would give the kids a safe future, finding teachers. We involved companies like IBM, training the children in the refugee camps, making them computer literate, and vast majority of these of the former children then are now very active members of their societies today. So in this field, I think we can do a lot. Otherwise, today's children of Syria tomorrow might be a wave of unhappy, jobless, sad people that would destroy their future and the future of Syria. So in this context, in the context of protection, psychological support, extremely important. Finding psychologists to work in the camps, be they professionals, working together with the UN agencies or the experienced NGOs, or volunteers. The volunteer work is now of importance, of huge importance, to find young people to work together with the professionals in the refugee camps. This is something that we don't talk very much about, but this is really important. And health, nutrition, also equally important. But I believe my colleagues from the UN agencies and other implementing partners that we have will come up with reasonable and well-designed programs to help these young people that are expecting not only our money but also our creativity to help them in the best possible way. Thank you.
And I'd like to add a few things, and I agree with my colleague that the importance of education, even during an emergency, even when you're thinking, okay, let's just deliver the basics, the importance of education for children should not be underestimated in giving them a safe space, hope for the future, a place to go that frees up their parents to do things, a place to color and draw and talk about their fears and what they've seen is very, very important. Secondly, we should be doing more to protect women and children from violence, and this is why this Safe from the Start initiative that the Secretary has endorsed is so important, I think. You know, there's a appalling situation where young girls, refugee girls, are seen as potential child brides by men in the region, and that young boys are seen as potential child soldiers. And so having enough staff to be on the scene to stop that sort of thing from happening, to encourage parents not to marry off a daughter, but instead to make sure she gets to the camp school is very, very important. The psychosocial piece of it is very important. It's not the type of counseling that would happen in Washington, D.C. if a kid had some emotional problems. It's more a group dynamic that has proven to be, even in very basic settings, to make a big, big difference to communities, so that they can understand what's happening to them, to their children, that the children can understand what they're going through and can respond appropriately. And then also, what I would like to see, and what I've seen in other situations, is a greater American public mobilization. What has been the most successful that I've witnessed in recent years was the whole Save Darfur movement that brought together university students with the faith-based community, with members of Congress all coming together, and the public really taking an interest in staying on top of the situation and taking action about it. We haven't seen that with this crisis, apart from the Syrian American communities. One of the things I did recently was arrange for Zinat Rahman, who's my colleague. She's the Secretary's Global Youth Ambassador, to come with me to Jordan to meet with Syrian youth living in Jordan. And then she came with us to Kuwait. She met with UNICEF officials, with Save the Children, and she could potentially be a very big help to me in trying to make sure that this issue is just not lost in all the many interesting aspects of this crisis, interesting and worrisome aspects of this crisis. So she is helping me to reach out, and also to reach out to more Americans who are younger than I am, to try to get them to care more about this. And I think that is a lot of potential.
Thank you. Let's turn to the audience now for some questions. I'll urge my panelists to take notes of the questions and answer the bits that you want to answer. Let me start with the young man over there. If you could stand up, wait for the microphone, introduce yourself, and ask the question.
Thank you. Mohammed Ghanem, Director of Government Relations and Senior Political Advisor with the Syrian American Council in Washington, D.C. I have a question for Mr. Feltman. The first round of Geneva II negotiations only got Syrians 600 food baskets the regime allowed into the Yarmouk camp for Palestinian refugees, although perhaps 60,000 baskets there would barely last a month. How many rounds of negotiations do you think it will take for civilian populations under siege to be granted humanitarian access, bearing in mind that these things should have been granted before the start of negotiations? And did the United Nations bring up the recent incessant barrel bomb campaign that intensified, especially over the past 2 days with the regime? Thank you.
Thank you. To the left here, the lady at the very back, please stand up to get the microphone. Microphone, we're not hearing her. Go ahead.
Okay, can you hear
Yes.
me? Okay, my name is Sarah Samaha. I'm with the Arab Student Association at American University. Most of us at this table here actually are. My question is to Ms. Richards. You mentioned the university initiative and how university students can help to raise public awareness, American mobilization, things of that nature. So I was just wondering if any of you panelists had any advice for us university students that are looking to raise awareness for the cause for the Syrian crisis. Thank you.
Thank you. Over there in the back. Lady at the back, next to the, I know you need, I'm trying to get it there to you.
Thank you. My name is Nadia Bilbesi with Al Arabiya Television. My question is for Ms. Richard. You said that the United States is the largest donor of humanitarian aid to the Syrian people. Can you explain to us the mechanism, or just tell us how do you deliver this aid? Because my understanding, if it goes through the UN, it's under the supervision of the Syrian government. And as you know, it's been accused of holding aids from certain areas. And does your aid goes to independent NGOs and to rebel held areas? And to Mr. Feltman, let me just very quickly say, I want to ask Mr. Ghadabian question. Will the United Nations issue a Security Council resolution to force the Syrian government for delivering aids to besieged areas should the Geneva talks does not result into any serious
Thank you.
Thank you.
Let me go to the very front here. Okay, stand up please so that they can get you the microphone. Microphone here.
Thank you very much.
Yeah, it's on.
Is it working?
Yes.
To Ambassador Feltman.
Could you introduce yourself for the
Yeah,
audience, please?
Munzir Sulaiman with Al Mayadeen TV. The focus of the negotiation in Geneva, it seems to me, it's not in the right track. Why the United Nations would not focus on the vision of future of Syria and force both parties to come up with that instead of insisting on the issue of dividing power or sharing power now prior to that interim government, how it's going to rule Syria. So is that any possibility that UN can redirect the negotiation toward that? To
Thank
Mr.
you.
Al-Ghadban.
But briefly, please.
Yeah, briefly. To Mr. Al-Ghadban, the missing part of your presentation is to give us some idea about the opposition. The opposition, many times they say they control 60-70% of Syria, but we don't see except the extremist organization on the ground practicing their Sharia law or their own law, while there is no single place that the opposition present to the Syrian people their example of the future Syria that they would like to present.
Thank you. Two quick questions in this round. The lady there.
Hi,
Please stand up so someone can see you. Thank you.
Kate Phillips-Brasso with the International Rescue Committee. This sort of dovetails with some of the other questions that were asked, but barring a political solution and humanitarian access being one of the primary ways that we can help the Syrian people, I'd like to hear more from the speakers on what the mechanisms for getting humanitarian aid into Syria are. We've heard about a variety today. One is sort of case-by-case negotiations like we've seen in Geneva this week on getting assistance into homes. We've referenced the presidential statement from last October, which offered us some hope that we would see movement, although I'd argue it's really been a trickle of aid that has actually been getting into besieged communities and hard-to-reach communities. Or, as several other people have asked, a possible binding Security Council resolution that takes an additional step and a bolder step towards trying to increase that trickle. I'd like to hear a little bit more detail in terms of what the most viable mechanism is to increase that assistance, barring a political solution.
Thank you. One more question. The gentleman there, please stand up.
To build on the previous question, or the one before the previous question, the credibility of the Itilaf among Syrian people and legitimacy is an issue. Do you think Geneva affected that, or positively or negatively?
Thank you. Let's turn to the panel, starting with Anne and then moving this way. Pick and choose the ones you want to respond to, and be brief so we can have another round.
I would welcome university students from the American University and other top flight universities to do more and to do it in the ways that you know better than I. But part of it is, the answers are out there in terms of all the Twitter feeds right now that are linked to No Lost Generation. So I believe the Twitter handle is Children of Syria, the hashtag. And so I know that if you go to Save the Children, if you go to World Vision, if you go to the International Rescue Committee or IRD and say you want to help mobilize your fellow students, they will do that. They will be helpful. Or UNICEF, USA for UNICEF, or the group that supports UNHCR here in the US. And I'd love to see you do it. On terms of how aid gets into the country, we pursue all channels to get aid into the country. We'll try almost anything to get aid into the country. And we don't have a problem getting aid to whole big chunks of the country. And we deliver humanitarian aid based on need, not based on political affiliation. So some of it goes from Damascus out. Much of it is funded through these UN agencies working with partners like the Syrian Arab Red Crescent. The UN has been successful in setting up hubs that is helping aid to get to other parts of the country. And we know that non-governmental organizations and local organizations are trying to get aid further and further into hard-to-reach areas. The problem is that there are still places where people have not gotten aid for months, and they're very dangerous places, and they have the right, as innocent civilians, to get aid. So we have agreement from all sides that this ought to happen, but yet it does not happen. And the problems don't seem to be today that all sides are refusing to let it through. It seems that it's really more that the regime could make a decisive difference. Does the regime have too heavy a hand on the United Nations in Damascus in determining how aid gets out? That's something that I worry about on a daily basis. I'm satisfied that there is a lot of aid getting to people in need who need it, to millions and millions of people in regime-controlled areas, people in contested areas, people in areas that go back and forth, where the battle lines are shifting, but it's still not enough. So that's why it has come down to these key areas. That's why they have become, these humanitarian issues are suddenly hopped over and are on the political talking points, is because we don't want to treat them as a negotiating tactic, as you were raising, but certainly if there's to be any goodwill, there ought to be more done to help innocent civilians. Kate Phillips-Barrasso, the International Rescue Committee, was asking about what more could be done. You know, in reference to the presidential statement from October 2nd, that really for me was a common sense document that showed all the many ways more could be done. The fact that that hasn't happened, that there hasn't been much forward momentum on this, that there's been really minor steps taken. I believe they were called baby steps earlier. That is a major disappointment. I don't feel we need more than what we currently have. We just need it to happen. And that's my great frustration.
Thank you, Anne. Engo? Mr. Gospodinov?
I do agree with my colleagues that it's a very sensitive issue, and again, based on my field experience, the balance between a strong desire of a humanitarian agency or an actor to go to the most dangerous places and bring the stuff is half of the story. The other half is the risk you take as a head of delegation or an agency to protect your staff, and what happens that if you try, you deliver a truck or two, but on the way back you lose 5 or 6 people of your people. Then what are you doing there to explain this to your headquarters, and how you actually damage your future operations when you may be able to reach even more people? It's a big dilemma, and it's a very difficult issue when you have to decide it in the field.
Thank you. Mr. Hadian?
The two questions addressed to me, the other side of the opposition, the extremists, terrorists. I think the regime's narrative of they're trying to fight terrorism was tremendously weakened a couple of weeks ago when local populations in many of the liberated areas, as well as all brigades of the Free Syrian Army, including moderate Islamists, turned big time against ISIS, the Qaeda-affiliated group in Syria. And let's be clear, from the beginning, we believed that this particular group, Daesh, ISIS, was a regime-created organization. The genesis of it is those who were trained by the Syrian regime to go kill Americans in Iraq. Some of you know the story. Some of them came back. They were in prison. They were released a year ago, more than a year ago. This is not to say that there aren't, maybe young people among these organizations who are driven to come and fight dictatorship and help other fellow Muslims, etc., and they're brainwashed into that. But this organization, its tactics, the way it's been attacking the Free Syrian Army, practices of imposing its extremist vision in the liberated areas, really played into the hands of the regime. And finally, people had enough. They turned against it. And they pushed it from these areas. So we are actually fighting on two fronts. We are the one who are fighting terrorism, in addition to the actual terrorism of the regime. The regime is the embodiment of terrorism. This is, it's history. All of you who've dealt with this regime, you know better. From Iraq to Lebanon to again, I don't want to go on to this. And I think that's why you've seen the regime totally isolated in Montreux. Nobody really buys it. It's discourse anymore. So, but at least let me say again, reiterate that we are committed to the pluralistic democratic Syria that respects international human rights and humanitarian laws, and that's the vision we want to have for Syria. As far as the question of the coalition and going to Geneva, it was a difficult decision. And in fact, because the coalition is made up of different groups, there were some who are not very supportive. Not because they don't believe in a political solution. I think some wanted to see more conditions that could make this conference likely to succeed. That was the difference within the coalition itself. But I think from the point of view of many of us, we believe this is the right thing to do. So we decided we should go there. We went there. The least we could go and make the case before the Syrian people that we are here to make, to find a political solution along the line identified by the Geneva Communique, which certain understanding and interpretation, which were in fact supported by the core group of the Friends of Syria, the 11 countries, in the London Communique, which provided certain definitions like this eventually means there is no role for Assad, that should be within a time frame, that there should be some confidence building measures, some of the things I mentioned. So I think we were equipped with that, in addition to support actually from the Arab League to go and pursue a political solution. I think the first week, the outcome of the first week was positive. We established I think communication with many Syrians providing feedback, and most of the feedback has been very, very positive. I think the next challenge now is to show that those, as you mentioned, Paul, that there should be, in fact, some improvement on the ground to allow us to continue this path.
Thank you, Rajiv. Ambassador Feldman.
Thanks. I'll make a general comment following up on what Dr. Ghadban just said. Again, I can't talk about what happened in that room, but imagine the scene. You have the Syrian government sitting on one side. You have the Syrian opposition sitting on the other side. They're not talking to each other. They're talking to Lakhdar Brahimi. So each side is talking to Lakhdar Brahimi, but the other side's hearing. This is unique in the 3 years of this conflict, where both sides are hearing what the other side, each side is hearing what the other side is saying. And to address your question, they did talk about their vision. They did talk about the future of Syria. The conference is a political conference. It is based on the proposal by the initiating states, the Russian Federation, the United States, for a conference to talk about implementation of the Geneva Communique. I urge you all to read that Geneva Communique again. It talks about principles of transition, talks about the democratic aspirations that the Syrian people have. It talks about human rights. There are lots of details. The establishment of a transitional governing body we've talked about, but it's a document that is broad enough on ending the violence and moving to transition that allows each side to provide visions on how each side sees the implementation. So I certainly am glad to hear you say that it was a positive experience for the opposition to be there, despite the fact that the actual tangible results are quite modest. But it was significant to be in that room and to watch them, each side talking to Mr. Brahimi about each side's views of the future for Syria. Going back to what I said earlier, this is a political process. This is a political conference. The goal is to end the conflict, move to a transition. The fact that these humanitarian issues came up in the discussion doesn't mean they didn't come up elsewhere. Doesn't mean that the UN folks on the ground weren't working on it. The people in New York weren't working on it. But it shows the importance of them, that the humanitarian actors wished Mr. Brahimi to also use the opportunity of the presence of these delegations to push the humanitarian agenda as well. But that's not the only venue or even the primary venue for the humanitarian discussions. In terms of a Security Council resolution, Secretary General has said repeatedly that he wants to see unity and action in the Security Council on humanitarian issues as well as on the political issues. We in the Secretariat don't write Security Council resolutions. Security Council resolutions are written by the members themselves of the Security Council. We would be supportive and hope to see Security Council unity on which we can build and operate. But it's not up to the Secretariat, but our views are clear that we hope to see Security Council unity behind some of the political humanitarian issues that we've discussed. Thank you.
Thank you, Ambassador Feldman. I'm sure we still have a lot of questions, but we do have to break for lunch, and you can, I'm sure, pose your questions directly to the panelists. I want to thank our 4 panelists for an excellent panel.
Look, before I introduce our keynote speaker, I'd really like to thank the panelists, all of them who joined us this morning and are still with us, actually, for sharing with us their very sobering view and at times extremely insightful observations about the humanitarian and political situation in Syria. If you're not already convinced from this morning's discussion, it certainly confirmed the observation that the Syria crisis is the largest humanitarian crisis of this century. I'm going to introduce a man now who, when he first walked into his brand new office as administrator of USAID, it was almost the morning of the devastating earthquake that nearly destroyed Port-au-Prince in Haiti. So you can see that Rajiv Shah is no stranger to humanitarian crisis. And this is certainly true since he was born and raised in Detroit. I'm sorry. I'm sorry. I'm sorry. I'm sorry. You know, but today, Raj Shah leads an effort of more than 9,600 professionals in 80 missions around the world. He's a medical doctor. He has a master's degree in health economics from the Wharton School of Business. And he's truly a Renaissance man because Dr. Shah has served for 7 years with the Bill and Melinda Gates Foundation as Director of Agriculture and as Director of Strategic Opportunities. Before moving to USAID, he served as Undersecretary for Research, Education, and Economics and Chief Scientist at the U.S. Department of Agriculture. He's agreed to take a few questions at the close of his remarks, so please welcome our Administrator, Dr. Rajiv Shah.
Hello, good afternoon. Thank you, Wendy, for that kind introduction. In all honesty, one of my favorite moments in this role was visiting the Syrian American community outside of Detroit, which, as you may know, is the largest Syrian American community anywhere in our country. And there are doctors from that community that go in and out of Syria and make a huge difference, doing extraordinary things at great personal risk. So I'm proud to be from Detroit, and I'm proud to highlight the accomplishments and service that come from that great city all the time. I also want to recognize Ann Richard, our Assistant Secretary of State for PRM, who is here and I think shared some thoughts with you this morning, and Nancy Lindborg. Nancy, as you know, is really the one who is, on behalf of USAID, leading this effort together with her colleagues Rob Jenkins and Alina Romanowski. They have really come together to make sure that all of the resources of our government and our agency can be deployed in whatever means are required to address what is the largest humanitarian crisis we face. So thank you, Nancy, for your leadership and for being here. Nancy needs no introduction. I'm thrilled to see so many of our partners here as well, and look forward to a panel discussion with outstanding experts who will share with you, I think in much more granular detail, the quality and the effectiveness and the challenges that we all face trying to address a humanitarian catastrophe that, of course, gets worse every day because of its root underlying cause remains uncontained. So thank you. Many of you are partners, many of you take risks to do this work, and many of you are critical to our efforts to help serve the millions of people who are in dire need right now. I was in Lebanon and Jordan just a few weeks ago and had a chance to meet, actually in that, there's a photograph up there for those who want to look, but to meet with a family, a young woman and her 5 young children who were Syrian refugees embedded in a community inside Amman. And she told me about leaving her home and her businesses. She described how her husband, after arriving in Amman, went back to make sure that their assets and property were protected and never returned. And as we were talking, her young children, including kids about the same age, some of them as mine, we're sort of running around the room and holding on to her. And she described how for the first time in 2 years, they were just getting the chance to go to school, how they had spent down all of their assets, went for a period of time without any food support, and we're now getting vouchers from the World Food Program to allow them to buy food in local communities, and trying to get back on their feet, but in an extraordinarily difficult circumstance. And while I only met one mother that day, we know there are more than 11 million people like her inside of Syria and across the region who have left their homes and been cut off from their communities and their livelihoods. I only met a few of the kids that day, but we know that more than 5 million of the people affected are in fact children whose lives will never be the same. Think about that. It's as if every student in the 25 largest US school districts, including New York, LA, Chicago, Miami, and 21 others, had been affected by violence, homelessness, hunger, disease, and malnutrition all at once and simultaneously. Since this time just last year, there are more than 4 times as many internally displaced persons and 4 times as many refugees. Over 40% of Syria's population is now in need of humanitarian assistance. So the scale of this challenge is unprecedented. Can we have the next? Do I click here for the next slide? This gentleman is standing in a pile of rubble in Aleppo. And in 3 years, we have seen that this brutal civil war has not only created a humanitarian crisis, but has taken a country of engineers and artists, entrepreneurs and doctors, teachers and scientists, and destroyed more than 3 decades of capital stock in that country. Literally, the UN estimates that Syria has lost 35 years of development in just 2.5 years of conflict. So even as we struggle to grasp the real meaning of all these numbers, we really can't lose sight, as Secretary Kerry just recently noted, of how this revolution began. Not with Scud missiles, barrel bombs, and systematic torture, but with graffiti cans and the peaceful protests of citizens calling for change. The United States will continue to stand with the Syrian people against the brutality of Assad's regime. But so long as the violence and bloodshed continues, no amount of humanitarian aid, and we have led the world in providing more than nearly $3 billion of support in humanitarian and developmental support throughout the region. But no amount of developmental and humanitarian aid is going to address this challenge. A negotiated political transition, as outlined in the Geneva Communique, represents the best opportunity to create a transitional opportunity. And as Secretary Kerry has said, Bashar Assad cannot be a part of that transition. A man who holds his own country hostage, a man who retaliates against hospitals and doctors, who has used both starvation and chemical weapons as tools of war against his own people, does not have the capacity to bring about peace. So, in this context, Syrians themselves must chart their own path forward. Secretary Kerry and the United States government are working relentlessly towards that political solution, and I know you heard from Jeff Feldman earlier about efforts in that regard. But it doesn't mask the fact that there is a critical crisis going on, and in many cases, it has acute consequences. Right now, in too many parts of Syria, civilians are being used as chess pieces in this conflict. In homes, and you can see a photograph, of course, of a burned out building there. People have been cut off from life-saving aid for months. In the Damascus suburb of East Ghouta, 160,000 citizens are still waiting for clean water and other life-saving supplies that cannot get past the regime's blockades. And we're not talking about fighters here. We're talking about men and women girls and boys, families and children. The roads are being closed by a government that has the capacity to enforce checkpoints and literally stop aid from being delivered across the line. This violates every basic humanitarian principle and is absolutely unacceptable. As Secretary Kerry recently noted, if the regime can allow access to the United Nations and international weapons inspectors, surely it can do the same for neutral international humanitarian organizations to provide food, water, and life-saving medical supplies to women and children in these communities. It is absolutely within their power to open these areas and to open them immediately in order to avoid the very real and accelerating pictures of starvation and abuse that you have seen. Despite these challenges, and despite the dire nature of the challenge we face, there are aid workers and doctors and nurses who risk their lives every day to bring medicines, perform surgeries, and deliver food in regions torn apart by violence. Since the crisis began, more than 100 NGO workers have been killed, tortured, or abducted. Not all of them have been caught in the crossfire. Many have been directly targeted, especially those that serve in medical facilities, for the very act of providing humanitarian support to those in need. They are truly humanitarian heroes, and the fact that some of them come from Detroit just makes me more proud. And thanks to their sacrifices, they are saving lives every day. The United States government has been able to provide food, water, shelter, medical care, and relief supplies to help 1.4 million refugees and 4.2 million people inside of Syria, including in the most ravaged areas like Daraa and Aleppo. Majid and his family were among them when the intense fighting forced them to flee homes. When his family arrived in Tartus, they had nothing but each other and the clothing on their backs. They managed to find shelter in a shared apartment with another Syrian, but this new home really didn't have the capacity to protect them. They sleep on cold, hard floors, and it's our humanitarian resources and partners that reach them and families like them with basic winterization supplies, mattresses, thermal blankets, winter clothing to help them through the cold season. It may not sound like much, and in the context of what we see on television and the fact that the number of people who have died in this crisis is now over 100,000, it certainly is not enough. But I want to assure you that America's investment in humanitarian support has made a huge difference for millions and millions of people. And at the same time, nearly 1 million patients have been treated at 260 field hospitals and clinics that we help support. And early warning systems for communicable diseases have helped manage and maintain the risks of widespread child disease and death at a time when infrastructure is literally falling apart. So it was in this context that earlier this month, Secretary Kerry and Nancy and Ann led our delegation to Kuwait, where the Secretary General was trying to raise billions of dollars for the humanitarian effort in the year going forward. He committed $380 million in additional humanitarian assistance, which now brings our total to more than $3 billion when you include the support we provide in Jordan and Lebanon. This is allowing a wide-ranging humanitarian effort to do things as unheard of and as timely and necessary as a massive polio vaccination campaign. We were all deeply concerned to hear about 23 confirmed positive polio cases inside of Syria. And the very fact that it surfaced inside of Syria when the disease had been eradicated from the region for a decade is an indicator of how quickly things can go backwards. Today, the UN is leading the largest ever polio vaccination in the region, aimed at immunizing 20 million children across the Middle East, including 2.2 million kids inside of Syria. So what does it tell us that we're able to actually mount these types of large-scale efforts when we put effort and get support to do so? It means that even though right now is a time of extraordinary crisis, we also have to look for and find and take advantage of certain core opportunities. And we've been trying to do that by bringing our humanitarian and development teams and efforts together to focus on building resilience in the country and in the region. Today, for the first time, Jordan and Lebanon have resilience plans in place to help their countries withstand the impact of the crisis and to keep their borders open to the needs of Syrian refugees. Today, almost 2.5 million Syrian refugees now live in these neighboring countries. In Lebanon, where I just recently visited, 1 out of every 5 people is from Syria. And in some cases, Syrian refugees now outnumber local populations in certain towns, especially along the border. In Jordan, the influx has been so significant, it's as if the entire population of Canada moved into the United States over the last 18 months. No comment about our Canadian colleagues. In both countries, the greatest concentration of refugees overlap with the poorest communities. And this is important because this means we have to do things in a sensitive way. If we rush in and just provide traditional humanitarian support to refugees, walking right by the children who are not going to school, who are getting displaced, who are also in dire need as their economies are under extraordinary stress, we will only be fueling the divisions and the risks and the consequences that prevent unity from succeeding. And that's why we've done some really unique things to help support our colleagues in Jordan and Lebanon in particular. In Jordan, one of the driest countries in the world, we're providing more than $20 million through a complex crisis fund to help communities manage their precious water resources. In fact, our developmental water programs with Jordan over the last 5 years have put enough water infrastructure into the north so that the entire Zatri refugee camp, the largest one in Jordan, is fed clean water through a USAID project that completed just before the crisis started. We've set up revolving credit funds so families have loans to install cisterns for harvesting rainwater. We've expanded access to health systems and schools and clinics so the Jordanian people and the Lebanese people also have better access to basic services. And this effort around local school systems is perhaps most critical and most significant, since half of all refugees coming from Syria to these two countries are school-age children. In Lebanon, this is a photo from my recent visit there, but in Lebanon, we've helped rehabilitate over 180 public schools to improve the infrastructure of those schools, to create more capacity, train teachers, get science lab equipment. These students here were challenging my scientific background into these schools. And as a result, in many of these places, as you well know, they're now able to provide education to Lebanese kids in the morning, Syrian kids in the afternoon, and this trend towards the double shift is going to be a big part of making sure that kids get a chance to go to school. Now, we want to be sure that this devastating crisis that has robbed people of their homes does not rob these children of their future. And that's why we launched in Kuwait the No Lost Generation Initiative. The idea is very straightforward: to make sure that even as we face a crisis now, we're putting in place some solutions as best we can to ensure we don't end up with a generation of young children whose only experience with the international community is not being there when they needed us most. Many of these kids have been out of school for over 2 years, and nearly 4,000 of their schools in Syria are sheltering displaced families or have been damaged or destroyed. And yet the future of what we hope is a democratic and stable Syria will depend precisely on these kids returning with the skills and capacity to be part of a positive future. That's why the United States has now committed more than $100 million to schools in Lebanon and Jordan and some inside of Syria as part of this No Lost Generation initiative. It's why I'm spending time calling my counterparts to ask them to match these efforts, because even as we fight a critical, immediate humanitarian crisis, we need to build the infrastructure that keeps this generation of kids on track to be productive citizens for a more peaceful and a brighter future. So I'd like to conclude just by saying thank you. I look around this room, I see so many folks who are part of our partner organizations that are out there doing this work. And I know that largely what you do is unheralded. Almost every article we read or see starts with a narrative that says, we're all not doing enough. And it's hard when you look at these kids and you see what they're going through to think we are doing enough. We can never really do enough. But the United States can be proud of the fact that we've been the primary support of humanitarian aid and assistance, that we've done it differently, aggressively, more creatively in order to reach people inside and outside of Syria, and that we've done it in a manner that is enabling Syria's neighboring countries to at least continue to have economic stability and hope for the future. And my final request of all of you is that you continue to stay committed to this, continue to tell this story in Congress and around our country, so we have the capacity to extend this forward in the year ahead. Thank you.
Well, thank you very much. Administrator Shah has agreed to take a few questions. He does have to leave in 10 minutes, so we have just a few questions. I'll just start with one. One of the takeaways from the very good presentations we had this morning, I think it was Mr. Abdullah Dardardi, mentioned that one of the primary reasons that the refugees are leaving Syria and going to Lebanon and Jordan and Turkey and Iraq and elsewhere is the lack of livelihood. They don't have any jobs left. Yes, they're fleeing the fighting, but lack of livelihood was one of the primary reasons why so many refugees are leaving. What are the strategies that USAID, who have very good livelihood programs elsewhere in the world, what are the strategies that you might have for the Syrian refugees?
Well, thank you, Wendy. You know, I'd say two things. The first is through our Office of Transition Initiatives and State Department partners, we have tried to create opportunities inside of Syria in certain communities, and that ranges from helping local coordination councils conduct basic public service activities like picking up the trash, to creating actual employment opportunities for young people in those areas. We've also helped in refugee communities in Lebanon and Jordan to create those kinds of opportunities for livelihoods. But the reality is, as perhaps pessimistic as this is to state, obviously it's difficult to consider folks having access to sustainable economic livelihoods in this current context. And until there is an agreement, until there is some kind of transition, I think a lot of those efforts, we have to be honest with ourselves, are simply not going to measure up to the need.
Good answer. Let's take 4 questions at once. Man in
From Islamic Society of North America. I mean, it's with a sense of pride that we listen to you and the reports from all different organizations. But I also wanted to express that we are very grateful to another resource that we have in America and needs to be fully tapped. You actually refer to that. Our component of the Muslim community in America is hugely from Syria, from all over the country. They have been institution builders in this country. A couple of months back, Islamic Society of North America sponsored conference of the Syrian organizations, about 15 to 20 of them. We were very honored to have representatives from your organization, from White House, from State Department, and others. So the way they express themselves, the support that they show for a democratic Syria is such a source of strength for all of us. So when you go to these places, when you talk to them, I wanted to make sure that you are fully cognizant of the fact that American Muslims, because last year we were celebrating our 50th anniversary of our institution building in America. That means this is the only Muslim community that was celebrating to have lived in a democratic country and has internalized those democratic values and resources and
Good,
ready
thank
to
you.
support you and strengthen you.
Thank you very much for that. Do we have any questions? Yes. The young man from American University, I bet.
Hi, my name is Sohaib from the American University. Woo. You mentioned, and the rest of the panelists mentioned a lot about the children, but what about the youth, the transition between children and adults, and the importance of youth in development and humanitarian issues? The USAID actually had a report in 2012 about youth in development, and I was just wanted to see your comments or thoughts about the role of youth, those who are in refugee camps or in the military or whatever. What role do they have in civil society, I guess, or anything?
Let's take a couple of questions. The young woman here in the white.
Hi, Natasha Hall from USCIS. I just had a question. We keep talking about the lost generation, and it's kind of recalling a lot of memories of Iraq for me, and I'm wondering if there's any lessons learned from Iraq, even some NGOs that are on the ground that could possibly be used for this particular lost generation. Thanks.
Okay, one more question before we give him a chance to answer. The gentleman in the corner.
Yeah, hi, my name is Bassam. I'm from Syria. Doctor, if I don't know who you are, I would think you are working with Jumana and Syrian Relief. I'm unfortunate that I will tell you that the Syrian people, they don't feel what the Americans are doing. What you are doing, it's highly appreciated within American society, with intellectuals are living in this room. But when you go, as you have been to Lebanon, Jordan, or Syria, or Turkey, the Syrian, they all ask what American is doing. So I think you are missing very much PR campaign with the Syrian. Thank you.
Okay, let's give him a chance to respond.
Thank you. Well, let me address the first point over here, and I just want to say thank you. I think the diaspora community in this country has taken on tremendous responsibility at great personal risk to be a part of this effort, including things we're not going to be able to discuss here, and I'm very, very grateful for that participation with the diaspora community. With respect to youth, and I appreciate the question from our colleague from American University. Look, I think the reason we focus so much on school-age kids right now is because this is an opportunity to build out an educational infrastructure with all of these resources that are going in. And whenever we can find opportunities to both meet immediate humanitarian needs and build the long-term infrastructure that will make the region stronger and more capable, we ought to be using these crises as moments to build out that infrastructure. And that's the inherent rationale behind our resilience work and this No Lost Generation effort. I'm very worried about older, non-school-aged youth. There are, it's not like this is an environment conducive to significant job creation. And, there are going to be a lot of people who are going to spend too much of their young adulthood on the intersection of violence and conflict as opposed to personal development and economic development. And that's not good for the region. So, but I think we have to be realistic about, all the programs and humanitarian efforts in the world are not going to change the dynamic. You're going to need some kind of a political settlement. And I think we should be holding up these pictures and these numbers and the reality of these besieged areas and beating the drum for a more rapid process to achieve that political settlement. Finally, I would note to the gentleman who spoke about the Syrian people and their knowledge or appreciation of these efforts. I've now been in this role for a number of years, and I have come to learn that we are, as a country, expected to do a lot in a lot of settings around the world. And, I sat with Syrian refugees in the camps in multiple countries, and they want to know, why don't we have boots on the ground? Why don't we have planes in the air? They appreciate the humanitarian support, but there's a perception that America could resolve the conflict quickly and efficiently. And I think you've heard from the President and the Secretary of State and the Secretary of Defense. And so I'll just repeat the unfortunate reality is that's simply not an accurate belief. And so we do this work because America has been the humanitarian leader in the world for more than 6 decades, and we will continue to do it. And it is an important part of how we build the basis of a future that is peaceful and secure and defined by opportunity. We can't do this work with the expectation that the reason we're doing it is because we want people to appreciate what America does. We always want people to appreciate what America does, and I find they do more when we don't ask for it. We just get about delivering results. But let's also be honest that everybody would like to see a quick resolution to the horrific violence, and that is going to require a political settlement. And that's what Secretary Kerry has been working on so aggressively. And that's why we all continue to focus on delivering that. And that's the focus of our administration's effort on this.
Thank you for that honest and candid response. And I think it's a good way to end a very, very interesting morning. Thank you so much, Rafs.
Thank you.
Yeah,
Thank you. Thanks. This was great. I really appreciate it.
You were terrific.
Oh, good.
You
Thank
were really good. All right. Well, thank you all very much. Again, thank you to our sponsors, ACOM and IRD. You have time now to stop at the table in front and join membership of the Middle East Institute.